Good morning, speakers. I see everybody's face. Hey, Ashley, Brandon, Mo. I'm assuming that's Sam. And there's the effervescent Viviana Ortiz. Hey, Michael, prep for all. I'm Jose. Nice to meet you. There's Michael Hinson. And hey, Mr. Blackwell, nice to see you this morning with us. How's everybody? We had some technical stuff this morning, and none of us were able to get in. We couldn't figure it out. We couldn't figure it the, you know, and I'm not a technical person, so I really didn't know. And in fact, I just actually got on like 3 minutes ago myself. I'm frantically like pushing buttons and hoping I could figure it out. But anyway, I'm really sorry, guys, that we had the technical difficulties. And as I said, we're not tech whizzes, so James walked us all through it and we got through it. So how's everybody today? Good.
Pretty good.
Yeah, I just got a text saying Action News may join us, I think. I don't think there'll be a lot of action here today, just a lot of talking, but you know. Hey, yeah. You can come in. All right. I've never had this many people in my bedroom before. Hey, Sam Rivera. Thank you for being here with us today. Give us a heads up when you're about to start, James. Oh, okay. I'm sorry. Another, what we call it, a faux pas? I'm sorry. So good morning, everyone. Thank you all for being here. As I said this morning, I apologize. We had some technical difficulties, but we're all here right now. My name is Jose DeMarco, and I'm a founder of the Black and Latinx Community Control of Health. I've also been a longtime organizer within ACT UP Philadelphia. And again, I want to thank you all for being here with us today, because you could have been doing so many things on a Saturday morning, but you're here with us, and it's really, really important that you are, and we really appreciate the time you're giving us. At Black and Latinx Community Control, we are all unpaid volunteers. We operate without hierarchy. We operate without a staff. We operate without a board. We're made of basically of community members that are impacted by issues that affect BIPOC, LGBTQ folks, with a direct focus on HIV. The only requirement is a desire to end HIV infections in our community and poor health outcomes. Being born Black or Latinx in this country means we are likely to be unhoused, incarcerated, poor health outcomes, HIV positive, victims of police violence and death. And that includes men, women, and children. No person of color is exempt. If you are queer or trans, these issues are compounded. Being HIV positive exacerbates all of these issues. So we realize that after 4 centuries of enduring structural racism, it's now time for our white friends and allies to become accomplices and to use their privilege to help us dismantle the structural racism in this country. We've been trying and seeking equity for over 400 years. That's a really, really long time, 400 years. Not 4 months, not 4 years, not 4 days, 400 years. And most of us are standing on the works and the backs of our ancestors that I want to honor here today. And also, I wanted to mention today, speaking of ancestors, is Fred Bean, that was part of the initial Black HIV movement and also queer movement that wrote before Lady Gaga got her hands on the song Born This Way. He made a really great version of it that lots of young folks don't know, but he was one of my heroes. So anyway, today we have some really, really fabulous speakers. We have Kieth Boykin, New York Times bestselling author of 3 books, One More River to Cross, Beyond the Down Low, and his newest book, Race Against Time, that we are going to give copies away every hour here, so free copies. We have Brandon Brooks, former Philadelphian trader, is a research for PrEP and HIV prevention for queer Black men. He does fabulous, fabulous work. And he took it all to New York. We have Michale Chancley, sorry, Mike, director of PrEP for All program that works with HIV prevention in hard-hit areas deep in the South. We have Sam Rivera with us today, Boricua, director of the nation's first and only safe injection site, or should I say overdose prevention site. And we're really, really proud that he's here. We're happy that he's here, and we wish him the best of luck. Our moderators today are Mike Hinson, who is the CEO of Self Incorporated, the largest shelter system for single adults in the city. Mike was the former director of Colors, which was one of the first LGBTQ BIPOC organizations in the city. They produce a fabulous magazine that no one else could produce. Mike is also the first liaison to the mayor's office for the LGBT community. Mike was responsible for funding the very first trans conference that Mazzoni now handles. Michael was also the little signs that you see down the center city that say neighborhood. Michael is responsible for those. Michael's responsible, I think, for getting funding and founding the first Black gay pride in Philadelphia. I mean, he has a long, long legacy, and my hat is off to Michael for, a lot of us are standing on the work that he does today. And we also have with us today Viviana Ortiz, a proud Boricua nationalist, a member of ACT UP Philadelphia, a member of Community Control. And Vivi is a compassion harm reduction specialist for the most complicated and underserved community in Philadelphia, active drug users at Prevention Point. So today we look forward to a robust conversations about the seeding and or equitable sharing of power for the Black and Latinx communities. I have to take this time to thank the Philly AIDS Thrift, who have stood by us and supported us since our very first symposium. I want to thank Prevention Point that has stood by us from the very beginning. And I also want to thank the Health Department AIDS Activities Coordinating Office that are trying to seek racial and health equity in this work. And this is why they're helping us produce this symposium. So I wanted to give those acknowledgments out to our supporters. And yeah, we have a lot of, we're starting to get not anonymous, but we're starting to get donors that are white individual that really support our work. So it's time to take donors and turn them into accomplices. So maybe we can figure out a way to do that today. So right now I'm going to turn it over to Mike Hinson and Viviana Ortiz. You got it, Mike?
How about we get unmuted to start this off? I'm going to actually ask my very well and capable co-host, Viviana Ortiz, to get us started.
Good morning, everybody. My name is Viviana Ortiz. As Jose DeMarco mentioned, I am a longtime activist, a Boricua nationalist who believes in the freedom and liberation and independence of Boricuas. And I believe in fighting white supremacy. And I've been a long-time activist and advocate for injection drug users, queer people, and Black and brown people in this country. That's what I can say right now. I have a lot to say later on. Mike, the mic is yours.
Thank you, Viviana. So I'm Mike Hinson, and listen, I'm ready for an exciting conversation today. I am just a country boy from the low country in South Carolina, in Stuckey, South Carolina, where there are currently 249 people who live in my town, and my cousin is the mayor of our town. And I like to really think about, you know, being raised by my grandmother, who told me when I was about 9 years old, my uncle had a friend who was transgender. Of course, I didn't know at 9 what transgender was, but I knew that my uncle's friend was different because his brothers always made fun of him because he had a trans friend. And my grandmother reminded them and reminded me to always be kind to people, to always respect people, no matter what their differences were, because they're human and you may one day need that very person. And that has been the path that has driven me to, you know, all of the advocacy and all of the public health and all of the getting in people's face and saying, I'm not moving until you move this out of my way. That has been what has driven me to do the work that I do. And I'm very excited to see so many people here who I either know directly or know of their work. I'm so happy my friend here, Yolanda French Hollis from the Pennsylvania AIDS Law Project is here. She's been in this work for, I don't want to say Yolanda because I don't want you to fight me, but Yolanda has been, I mean, not just an advocate, but a leading attorney really fighting for the rights of people living with HIV in Pennsylvania, in fact, in our region. And I'm so happy that Yolanda is able to join us today. There are just so many folks here that we have since 1993. Thank you, Yolanda. There are so many folks that we have here that have been carrying this basket, carrying this torch for our communities for so long. And I hope today that we can have a very open, authentic, and transparent conversation about where we've been and where we're going, because we are definitely going to dismantle racism and bias and discrimination in all of our systems that have historically prevented us from living our best and full lives. I see my friend Ashley Coleman from GALAEI. I'm so happy. I'm just saying this because on yesterday I was talking to a reporter, and the reporter asked me, what does it look like to dismantle racism? I said, for folks who are in seats that have been there historically, some of our own friends, to move out of those seats and let Ashley sit there. It's that simple. It's not a lot of thought that goes into it. It's that simple. You're our friend. You understand what needs to be done. Get up, move out of the way, and let Ashley sit there. So with that, I am going to ask you all to do a couple things, if you might. If you are compelled to, by me asking, if you can please put in your name or add to your name your pronouns. That will be helpful for some folks as we communicate throughout the day. That would be helpful. I will also ask you to use very freely and frequently the reactions that are located at the bottom of the screen. They allow you to say when you feel excited about something by clapping your hands, when you agree with something by raising your thumb, when you just love something by doing the heart signal. And when something is funny or celebratory, the other symbols are there for you to use. The reaction symbols will also allow you to raise your hand when you want to offer comment or contribute to the conversation in a positive and strengthening way. We ask you to raise your hand. We also ask that if you find that you have questions for any of our speakers throughout the day, so that we can catalog those questions and the answers, we also ask you to put those questions into the chat. Allow the moderators, my friend Viviana, myself, or anyone else who might be moderating at any given time, to call on you for your questions. That allows us to hopefully have a really efficient and decent exchange with our speakers, who we are excited to have here today. So Jose has already spoken about our speakers. I will again just say who our speakers are, just so that you know. The 10:20 plenary session, which we are 2 minutes behind, which is really great. We have, of course, my good friend, longtime advocate, writer, government official, just a really great and decent guy, Kieth Boykin, a friend who I've lost contact with since he left Philadelphia and made his way to New York City, Brandon Brooks, Michale Chancley, and of course, Ashley Coleman, and Sam Rivera. These are our plenary speakers for today. So we are going to get started with Kieth Boykin and ask Kieth if you can get us started. Again, folks, if you have questions for any of our speakers, we do ask that you place those questions into the chat box, and we will call on you to get your questions addressed. Kieth, welcome this morning. Thank you for being here with us. Thanks for all the work that you've done historically and all the work that you can continue to do on behalf of all our communities. I remember very fondly the work that you did with the founding of the National Black Justice Coalition, which is still today a standard for Black folks and Black organizing and community control of our lives and our existence. So Kieth, I turn it over to you.
Well, thank you, Michael. I'm not sure how long you want me to speak for, just a couple of minutes, I guess, for introductory remarks.
That will be awesome, Kieth.
Okay, thank you. And, it's a real honor to be here today. And thank you for your leadership, Michael, over the years. I've followed you and watched your leadership and career for some time now, and I've always been impressed. And as soon as I heard your name was attached to this, I immediately decided I wanted to be a part of it. So thank you all for putting this on. Thank you for inviting me to be a part of it. Today is National Black HIV/AIDS Awareness Day. And it's an important day for us to not only reflect on where we've been, but where we are and where we're going, as Michael mentioned. I am old enough to remember in 1981 when we first heard of HIV/AIDS. And in June 5th, 1981, when the CDC released its morbidity and mortality weekly report that discovered this new virus that was early on known as GRID, gay-related immunity disease or something like that. And it was obviously mischaracterized from the very beginning. And there were a lot of stereotypes and misinformation about it from the very beginning. I remember from the very beginning, there were 4 groups that we were told were the only groups that really had to be concerned about this. And they were the 4 H's, we were told: homosexuals, hemophiliacs, Haitians, and heroin users. And it was a way from the very beginning of otherizing the HIV/AIDS epidemic. It was a way from the very beginning of separating who should be concerned and who should not be concerned. And the reality was that for many of us in the African-American community, even though this pandemic was being described in terms that seemed to reflect its impact on white gay men in cities like San Francisco and New York, it was disproportionately affecting Black and brown people, particularly Black people, from the very beginning. We knew this from the earliest CDC data. And unfortunately, this is not an even, clean story where you can just sort of blame one group or another. I think all of us bore responsibility for this. Even in the Black community, many of us were in denial about this until we started to see people like Arthur Ashe and Magic Johnson and others who started to share their stories. And then we realized that it wasn't just a white disease, it wasn't just a white issue. And we were slow to, I think, in some communities address that. But we did address that. We did create our own organizations, our own institutions. We created institutions like the ones you've created in Philadelphia, the ones in New York City, here where I am, in Los Angeles and Washington, D.C. There are still standing organizations today that represent that type of community control, because Black LGBTQ people, Black people living with HIV/AIDS, Black people in general just decided we all wanted to take control of our own communities and exercise that form of leadership. And so when you talk about the issues of structural racism and fighting that within the context of this pandemic and the context of the larger issues, I have to just sort of lastly bring us back to where we are politically in this country right now. Just a week ago, the President of the United States said that he was going to nominate a Black woman to the US Supreme Court. And that simple statement created a commotion of controversy in our country because of the notion that somehow this was going to be an affirmative action selection, or it was going to be a quota or something like that. And the reality is that in our country, we've had 115 Supreme Court justices, and 108 of them, the first 100, most of them basically, but 108 of them have all been white men, in a country where white men are only 29% of the population. And then when someone merely suggests having some sort of compensation or recognition of the fact that white men can't possibly be the people to make decisions for all a society as diverse and pluralistic as ours, people seem to get upset about that. But this is what we're fighting against. We're fighting against people who are concerned about teaching Black history in schools. We are in Black History Month, and there is an active movement in our country to prevent the teaching of Black history. There's an active movement in some states, in the state of Florida, to make it a crime for teachers to even teach anything in school that makes white people feel uncomfortable. The governor of Florida today is supporting legislation like that. And we have a movement in our country to demonize people who do not fit into this sort of white, male, patriarchal, heteronormative, structural definition of what they want our society to be perceived as. And we have a duty to resist that. So I'm happy that we're able to take time to sort of reflect on where we've been. I'm happy that we're able to think about where we are today. And I want people to know one thing about the future as I move forward. I don't want anybody to assume that the future is guaranteed in any particular way. You know, Dr. King said that time is neutral. And in his letter from a Birmingham jail, he warned us that we have to avoid the tragic misconception of time, to think that somehow the mere passage of time will make things better. The reality, he said, is that time can be used either constructively or destructively. So we have a duty to use our time constructively, because the people who are aligned against us are surely going to use that time as destructively as they can. And we must be the ones to take control of that narrative.
Wow. Thank you. Thank you for that opening, Keith. Thank you. Thank you. Thank you. Thank you. Ooh. Knocking on my wooden table. Ashley, come on, Ashley.
Thank you so much for having me here. Michael, and today, my name is Michale.
Ashley, we might be having a little trouble hearing you clearly.
Can you hear me?
Yes.
Yes. Okay, good. So I'll start once more. So thank you so much for having me here. Thank you for your kind words, Michael. Jose, thank you for your leadership. Thank you for having me here. My pronouns are she, her, and hers. My name is Ashley L. Coleman, and I am the executive director of GALAEI. GALAEI was founded in 1989 under the revolutionary leadership of David Acosta. And as GALAEI has evolved through the years, it its original focus was on the Latinx community, really to confront the fact that there was disproportionate access to healthcare services for Latinx individuals here in the city of Philadelphia. As we've seen an evolution in our city, in the needs, in the desperate needs of the most marginalized in our communities, GALAEI has evolved. In 2021, I was brought on as the new executive director, as the first Black executive director of GALAEI, to evolve the organization to be for all folks of color, for all queer, trans, Black, Indigenous, and people of color. We watched an insurrection. We have watched police violence running rampant through our communities of color, killing our siblings, most impacting our Black trans siblings specifically. And it was important that we noted that one of the greatest tools of white supremacy is separating communities of color. It waters down our power to keep us all segregated from one another. Although the only thing that truly separates us is the continents in which the ships left from before they got to the shore. That is the only difference that we really have in our communities. We share spaces, but we don't share space. So for GALAEI, it is important that we rebuild the bonds that were severed by white supremacy to eradicate HIV, to eradicate white supremacy in our neighborhoods, in our community. It is important that we work together because collectively we know that we are powerful, we are resilient. We as Black and brown individuals have been on the forefront of queer liberation since the inception of queer liberation. We are the ones that have been carrying the charge since day one, since the first brick at Stonewall, since the sit-ins at Dewey. We were the first folks on the front line, leading the charge. And we are the first folks who are silenced in the movement. So it is important that we take care of one another and that we do it collectively. So I'm so excited to be here with all of you because that's exactly what we are going to do. We are collectively going to figure out a way to tell our funders to stop pitting us against one another, pitting our Black and brown organizations against one another. We are going to begin to move our charge forward collectively. We deserve it. We deserve it as the individuals who have been leading this charge and as the individuals who are most impacted by all of these systems of oppression. So thank you, and I am ready to do this work with every one of you.
We are on fire, people. We are on fire. Hey, I want to throw something in here real quick before we go to the next speaker. Ashley, I don't know, I think you know this story, but when I started Colors, or really when I was the chair of the community planning group, the first chair of the HIV community planning group for Philadelphia, Estelle Richmond was the health commissioner. And at the time, the health department was given $120,000 to what is now known as Mazzoni Center to work with Black and brown people, and had no Black or brown persons in leadership. I went to the commissioner, health commissioner, Estelle Richmond, and said, that is not acceptable. It's just simply not acceptable. You need to take that $120,000 from Mazzoni, at the time PCHA. You need to take that $120,000 from them, and you need to make sure that that goes directly to organizations led by and for Black and brown people. The first piece of money, and I say piece because it's small, that Colors got was $40,000 from that $120,000. GALAEI got $40,000 from that $120,000. And for the political correctness of it all, Safeguards, who was a white-led organization, but had some folks that were Black and brown in their organization, got the other $40,000. So we went directly to the commissioner, said, this isn't good. You need to do something different. She took the $120,000, 40 went to GALAEI, 40 went to Colors, and 40 went to Safeguards. Little piece of
Incredible.
history.
And we see the impact. We see the long-term impact when you invest in organizations that are run by Black and brown, queer, and trans people. We see that that initial $40,000 was the seed that is grown into impacting tens of thousands of people in our city, in making sure that we are keeping our community viral load low. We know that this is an important piece of history. If we do not invest, and even when they are those little pieces, that $10,000, that $40,000, we know that if you do not invest, it directly negatively impacts the most marginalized in our community. And it has to be controlled by the folks that it is most impacted. So thank you for your work on that. Thank you so much.
I shall. Brandon, come on, Brandon. Come on, bring it back to Philly, Brandon. Bring it back to Philly, buddy.
I'm coming back. Can y'all hear me good?
Yes, we can hear you.
Well, thank you so much. I'm really excited to be here. As Jose mentioned, I'm not a trader. I'm just doing my work now in New York, but I still, have a very special place for my heart in Philly. Great to see you, Michael, as always. And we do need to catch up. It has been quite a long time, so I definitely agree. And I think what I take from today and just kind of listening to everyone reflecting, because it is also Black HIV/AIDS Awareness Day, is just how the past and the present keep rhyming and repeating themselves. And what I mean by that is we're seeing the same instances happening over and over again. We're talking about slavery, and then reparations, and then Reconstruction, and then we go backwards to Jim Crow, and we do civil rights legislation. Then we go backwards to the 1980s conservative, religious movement. And then now we're going to having the first Black president be elected. And then we're having a backlash, which has led up to, having a president, former president, which I don't like saying that name, but we'll just leave that alone. And then currently we're having our, political discourse around, race and racism. And so I take it as we've been dealing with the same thing for over 400 years, and nothing seems to be changing. And so while we are seeing, different forms of growth, we're still having to deal with the same issues over and over and over and over again. I feel like, it's really exhausting. But I guess the courageous part is that even though we're all tired in our various ways, we're still looking to grow. So that kind of is what's brought me to this work, currently. And so originally I'm from Denver, Colorado. I moved to Philadelphia about 10 years ago, actually. It'll be 10 years in September. And I was drawn to research. So I've been doing research now for over the last 6 years. And what I've also realized doing HIV research, and now currently doing health disparities research, is that eradicating racism and ism is actually not even just a radical idea, it just makes common sense, right? So if you want people to, if you want to have a healthy, vibrant society, you have to get rid of the barriers that prevent everybody from being a healthy, vibrant, contributing citizen. And if certain people are being discriminated against, being held back from opportunities because of, and just not being able to be treated just because of who they are, that doesn't make sense. And also just kind of holds the country back from actually becoming its idealized self. And so I take this kind of work in terms of looking at it from a research perspective. So being able to, put in systems and put in ideas and put in programming that actually uplifts those who've been traditionally disenfranchised. Of course, I'm talking about Black and brown people of color, our trans and queer brothers and sisters, people that are dealing with, high levels of poverty. And so my perspective is just really looking at it from a programmatic, pragmatic sense. People always say it's radical to want everybody to have housing. Well, it's not really radical, it just makes sense. You save money. If everybody is housed, that's just common sense. If you want everybody to have quality healthcare, that's just common sense. If you want everybody to have a decent living wage, that's common sense. It's not radical. It's kind of like, well, duh. Things which everybody want to have those kind of things. It's not. So when people say that's radical, I'm like, that's not radical, it's just common sense. So in my own work, prior to my current position at the health department, I was helping manage multiple HIV/AIDS prevention and treatment research studies that were centered in the South and the Midwest. And just kind of get to really know, different populations that are different from me, but are kind of like just mentioned, not even just a different continents, but just different cities, getting to meet different types of Black men. I say MSN when I'm in a research setting, so I switch my brain off from that. But also too, just having these kind of spaces are very important. We're talking about ceding control. Like you were saying, Michael, earlier, I'm kind of rhyming with you, is that it's to make common sense. If you want to have a healthy, vibrant society, you have to kind of move out of the way. You can't just sit there and say, oh yeah, well, we really want to help people. We want to be allies. When it comes time to ally, people aren't allying. That's going to be a problem. If you say you want to be, money's great. And I do agree, every coin is needed. We wouldn't keep asking for coins, but actually removing yourself from seats of power is important if you really want to have a very healthy society. So today's program for me is just very exciting because me working in a research perspective, I don't get to always speak with people that are doing more on the front lines work and the community work, because I'm always, in my little research silo just doing causative data work or programming. So I just wanted to say I'm really excited and I'm glad to be here, and I'm open to any kind of questions and looking forward to participating in today's event.
Thank you, Brandon. Thank you, thank you, thank you. Hey, folks, I might have to break with just for a second, just break with the speakers, because I noticed that my council representative has joined us, and I'm not sure how much time she's going to have this morning to stay with us, but Council Member Maria Quinones Sanchez has joined us. Council Member, I don't know if you wanted to say a few words or you just wanted to sit and listen and then chime in later. Are you there, Council Member? Okay. So
my
James, I'm not
apologies.
sure. Okay.
My
Good
apologies.
morning, Council Member.
Good morning. Good morning. I am here just to listen to all of the great stories and all of the good information that is going to be shared. If I have some input, all of you know that I work with you on the ground and on the field. I just wanted to be a good listener this morning. So thank you.
Thank you, Council Member, for joining us this morning. And so we will go with Michael. Michael, come on, Michael.
Good morning. My name is Michale Chancley. I am currently in Decatur, Georgia, born and raised in New Orleans, Louisiana, but have been a resident of Georgia for a few years now. I am currently I'm a social worker, currently working as the communications manager for an organization called Prep for All, where we address systemic barriers to access to PrEP, and currently also working on global COVID-19 vaccine access. So just a little bit about me. I've worked in the HIV field pretty much off and on as a volunteer most of my life since high school. Kind of fully came into the field in 2014 as a social worker. And one of the big things that I've taken on was PrEP, the HIV prevention medication. So that's something that's just kind of been like my passion, doing that work. So to just kind of answer the question, one of the things that's really important to me in eradicating racism in our systems is that we have to see people like us thriving within these systems. And that means seeing us thriving as patients, as community members, as researchers, as field workers, as upper management, executive directors, managing programs, things of that nature. So that's one of the reasons why I really like to be transparent in the work that I do. If I see inequalities, definitely making sure that we're talking about those inequalities. Something I think that's really important when we talk about the HIV field, and we're also seeing it, I think, just in healthcare in general, but especially with the COVID-19 vaccine and treatment right now. It's just dealing with like that medical mistrust of those systems. When we don't see ourselves thriving within those systems, again, not just as patients, but also as staff, also as members of community advisory boards. It's really hard for us to address that medical mistrust. We can't look at a system that doesn't look like us and then put all of our trust in it, especially knowing our history with all of these systems. I heard earlier somebody gave the analogy, even talking just like about Mr. Boykin. I heard that analogy talking about the Supreme Court. You know, it's hard for us to trust in the justice system or the medical system when we don't see ourselves within those systems. You know, so I always just try to make sure people see, not only do I, you know, work in the system and try to thrive in the system, but also, you know, I have to navigate the system as a patient who's accessing this HIV prevention medication. I've been on it for 6 years. So I've run into barriers within healthcare systems because, again, being in the South, we don't have Medicaid expansion. We don't have really good sex education. So navigating sexual health is not something that, as a Black person living in the South, also as an openly gay male, trying to navigate these systems. And then you have to navigate these same systems as an employee, navigating microaggressions within workplaces, and also seeing, you know, not seeing, oftentimes, depending on where you are, not seeing people in positions of power that look like you. So it's, you know, definitely, I think in order to really address the, again, just kind of reiterate, in order for the community to build trust in us, we have to address those systems from the inside as well, and make sure that we have a more proportionate control of these health systems. And right now, looking at the rates of the, you know, of the HIV epidemic, as far as like new infections, individuals who are diagnosed but out of care or not knowing their status, we definitely need to see more control of the overall field so that we can really address these issues such as inequalities, you know, inequalities, medical mistrust, getting people back into care, getting people to invest in their own preventative care, and trusting these systems. So I think it's kind of twofold. We can't really say that we're going to help a community if we're not addressing the internalized racism that we have in the public health field, in the medical field, in the HIV field, in COVID vaccine education and equity. So.
Thank you, Michael. Thank you. Thank you. Next, we have Sam Rivera. Sam, come on with us. Welcome. We got all these New Yorkers in the house today. You're on mute, Sam. Can we unmute Sam? James, do we need to unmute Sam? Oh, there you go, Sam.
Can you hear me?
Yes, we can hear you. Welcome.
All right. I really need time, man, because so many people presented so much. I'm like, it's going to be very difficult to speak to you about, you know, respond to some of what's come up without a time. Is there any way to get time, just to know a rough idea? 5 minutes, 3 minutes?
Yes, yeah, Sam. I think we got about 5 minutes.
Wonderful.
And then there are going to be opportunities for questions once all of the speakers go. Okay.
Okay, wonderful. Thank you so much. First of all, I want to thank Jose, who I know has been key to getting me to join this. So I really appreciate it. Hahom in Taino language, you say Hahom, which is thank you. I consider myself, I was trying to change my name and all that, but I wasn't able to. But I consider myself Afro-Taino. I'm an African who's also a native and a Taino. There's so much to say, and thank you all who spoke first, because I'm like holding on to my seat. I think I might have broken it with excitement. So, I want to talk briefly about where I started in this work. I don't like to call it work, but we must get paid and live. 1985 in the penitentiary. I just want to be clear, I was about 10 and a half years old. So don't start doing math and figuring out how old I am. But I was in the penitentiary in New York. I walked into a room. I walked into a space. I looked into a space by mistake and was yelled at by the officers telling me I'm in trouble now. I'm likely to die because I'm not supposed to be in the same space, in the same air with these people who have this disease, and I'm going to get it. I'm going to die. So of course, a Boricua boy from the Lower East Side, first thing I did was call mama. And I spoke to mom because they kept me quarantined, and she told me, oh, they're talking about HIV. And I'm working in a clinic in HIV on the Lower East Side. So let me tell you about it. and then proceeded to tell me my cousin had it and other people I knew had the virus. So I went from being quarantined and signing forms and potentially dying just because I was in the space to volunteering with these men and giving them dignity to die in dignity. So I volunteered with a nun. We went there every day, spent the day with our guys, and there was nothing. There was no medication. There wasn't even medication in the community, so I couldn't really blame the penitentiary for that. But the best we could do is sit with them, write letters for them, and then basically give them dignity before they died. I will give the New York State Penitentiary one thing. I don't give them much credit, but they ended up opening basically a hospice at Sing Sing prison, where any man who had the virus in the state of New York and who became very ill can go there and die in this space, and is also closer to the city, so it allowed family to visit them more often. So that was a very, very good thing they did. And so that was my introduction. I came home from prison. I go to the Fortune Society to try to get my life together. They open a HIV unit. I'm like, I've done this. I know a little bit about it. 1992, I started my professional career, and I was about, I think, 14 by that time. So that was my introduction, but I want to say a few things. I am timing myself so I could be aware of what's happening. I think one of the biggest mistakes we are making as a group, and this is why I love the term BIPOC, is we're allowing people to separate us. We are participating in that separation. We are in it. We do it all the time, and we need to stop. So, can you imagine, and we keep saying this, I am looking forward to the revolution being televised, but we have to lead that. We have to. Again, BIPOC, I might get another tattoo that just says BIPOC because it touches my soul to see that we are talking as a group. We often look at what's different about us. We are so much alike, and we participate in that shit where we say, oh, but look at you, or you're different. No, we're not, right? So it's important to do that. My sister Ashley mentioned before, in our communities, we are so spun that we are okay with fighting for the same crumbs, organization against organization, knowing it's not enough. And then we get upset with the other organization if they win the grant, right? That needs to stop, and it needs to stop immediately. And for those of us who find ourselves in these positions of power, it is our responsibility to make these changes, right? I had a friend, a colleague, some of you know him, so I won't say his name, but he was moving up in power. And I said to him, I said, what are you doing to pave the way, to open opportunities? And his words were, I made it here, they have to make it here. I said, really? If that was the belief and thought of your ancestors, you'd be picking cotton today, bro. So you better figure out what that looks like, because that is some sick thinking. We have to also thank anybody who supported us in our growth, but not think we owe them for the rest of our lives, right? We keep holding white people who supported us as these saviors of the world. We earned this. We earned this power. We're as intelligent. We know our communities well. I appreciate my white accomplice. I'm very well aware that we are not going to be able to do all this work without their support, but they don't have to lead. They have to slide over a little bit. We're not asking you to leave. We're asking you to slide over. Give us some damn room. We're comfortable being second or third. We're so good at that, right? Yeah, I'm third in command. I'm fifth in command, and we walk around proud. No. So it's also our responsibility to build the future leaders of color, people who want this. I am blessed in my organization to have a number of young people. One is on here now. Young people who want this, who see the possibility, who see this person who's been in prison and all these things leading an organization. So I know it's important to spread as much information as possible, to bring them in when I'm negotiating contracts and writing reports and fighting with the city or state for money and doing what we did, which to make history. We opened the first 2 safe consumption sites in the country. And I want to be very clear, because I've said this numerous times. I've been on the television many times, and not one person has shared this information. So I'll share it here with all of you. I took it over the finish line. It is our victory. It is not mine. It's not mine, man. So many of my friends and colleagues have died in this process. So many of my friends and colleagues have struggled through this process. When we opened, I lifted my hands up and thanked every person in HIV and harm reduction, everything we've done over the years to open the first 2 in the country. So I hope all of you on here and your colleagues and friends have celebrated with us. This is not ours. This is not mine. It's ours. It is our victory. And it's a beautiful thing. And I am blessed to go to work every day and watch people stay alive. That's our victory. Philly's next, Maryland's next, Houston, LA, San Francisco. We won't stop. And it is our responsibility to take this forward, right? We are like each other. Let's focus on how alike we are. And I think I went way over. So I'll try to stop there. But I have so much more to say. Thank you all. Thank you, Hahom, and bless you. I lit up a mixture of elements we burn, because as Native folks, we believe fire reaches the sky up to the Creator. We send our prayers through our fire. Hahom again. Blessings to all. Thank you so much.
Thank you, Sam. Thank you, Sam. Thank you to all of the presenters for getting us started and getting us on fire this morning. I've just received a message from our founder, Jose DeMarco, who said he had a message to give to us. Jose. And you should come off of mute so we can hear this very important message.
Hi. I forgot, I meant to, someone reminded me, I meant to say this earlier. There's a ancestor now that a lot of us are standing on his shoulders, and his name was Mario Cooper. Today was his birthday. He did a lot of early HIV/AIDS activism. All of the things we're talking about now, Mario talked about. And I believe there's an article, Kieth, you wrote an article about Mario some time back. If you could put the link into the chat for people, that would be really, really a good thing. But we never lift up our ancestors enough. And I wanted everyone to know his name, Mario Cooper. Today was his birthday.
Yeah, I was looking at my calendar. I thought his birthday was February 7th, actually, according to my I have my contact for him, February 7th, 1954, but I could be wrong. But Mario Cooper was a dear friend of mine. And, I worked in the White House as a special assistant to the president in the Clinton administration as an openly gay man. And people always say that, I was one of the first Black gay people to do that. But Mario did the same thing in the 1970s. I believe he was openly gay in the Carter administration. And so he was a mentor of mine, an inspiration. He helped to start a number of HIV/AIDS organizations that service the Black community. I think Leading for Life was the last organization he started. Wow. I'd forgotten about his birthday until you mentioned that, but it just brought up so many memories of what a wonderful, wonderful spirit he was. Thank you, Jose.
Yeah, sure. And I think Mario was sort of unsung. I never had the opportunity to meet him. I've only read about him, and I know Mario through people that knew and loved him. So I really think, some flowers for his memory today are definitely in order. I wanted to say that. Thanks, y'all. Okay, Mike,
Thank
I'm
you,
done.
Jose.
Sure.
Thank you, Jose. Thank you for that. Thank you, Kieth, as well. Vivi, where are you, Viviana? You want to get us started with some questions? I see a couple questions in the chat from Sterling Johnson. I also see a question from Mo Santana. Do you want to get us started, Vivi?
Yeah, yes. So I see Mo's question right here. Mo's question is, Sam, how were you able to get the community and the city on the side of harm reduction in leading to open the first consumption site over those prevention site?
Yeah, so first I'll say, again, I mentioned it as I was closing my piece. There was a lot of work before me, a lot of work. I tell people we've been running a relay race for years and years and years. Philadelphia got very, very close. Unfortunately, that didn't work, but it will. I took the baton again. I ran in the middle, they allowed me to rerun. I took the baton again at the end and passed the line. First of all, listen, we have to give credit, and people may not like this, but I'm going to do it. In New York City, we whatever the strategy was for de Blasio as he was leaving, didn't matter to me. People got caught up in that. Like, oh, he's doing it for himself. Listen, if that's what he thinks, let him believe that. I know that it didn't matter. This was so important. So how did we do it? I think one thing is we were ready. And one of the things I really want to, and it's not enough time here, but we want to make ourselves available to talk to organizations who believe they're ready. And it's not judgment. Let's just be real. There is so much that has to happen in the background, and we had to do it in like 2 weeks, 3 weeks. Separate bank accounts and insurance and all of these things that matter. The other piece is, listen, I'm a fairly smart guy, and mom taught me well. I started reading things closely and looking at loopholes. The community board believed they had a vote. When I learned they didn't really have a vote, they just had the right to say something, it was over. I ran hard, because uninformed people, really, really, truly uninformed people, should not have a vote on something that we know works. That is dangerous. I really believe it is dangerous that they have the right to vote on whether we operate something that has saved this freaking world of too many diseases and too many deaths, right? So that was another thing. It's kind of like, in your jurisdiction, it's important to know what you can and cannot do and push it as far as possible. I had a board who was willing to take the risk with me. I had staff who, when we announced it, this is what we've wanted. This is what we wanted. So it wasn't convincing anybody around us. But the biggest piece is also, I don't know the biggest, but we were ready. We had the ability to set up the sites. We have a staff member, Kaylin C, who's worked in Canada. So we were ahead of it in that way. So what we want to do now is work with other jurisdictions to make sure all those boxes are checked, every one of them. We are making ourselves available. I'll be traveling a lot very soon. But the other piece around the community is I took a lot of time to educate the community. For instance, people said there were rallies. There was one rally with maybe 20 people. I met with every one of them. And now they want to participate with me, stand with me the next time I'm on media to talk about the fact that now they're getting it. So the other thing is impact. We've been open almost 2 months now, just about 2 months. The outcomes are outrageous, right? The city was hoping we can reverse 130. We're almost at 130 now, right? The numbers of people participating. We just got a call, and I'll wrap it up here. Sorry, I'm just so excited. We just got a call from one park, which is located across the street, Highbridge Park, if you know New York City, located across the street from our Washington Heights location. We get a call from the commissioner, one of the commissioners, assistant commissioners, that says, "What did you do different in the park?" Every month we've collected 13,000 syringes. 13,000. This month they collected 1,000. Say that everywhere you go, people. Say it. 12,000 syringes came home to us. Give them to us. We want them. 12,000 of one park. That's the kind of stuff you can't change. You have to accept that. So that's the opportunity we have to also speak back to the community. Last thing I say about that is this. The community doesn't want people using in the street. We don't either. They don't want syringes in the street. They don't want syringes in their schools. They don't want paraphernalia everywhere. We don't either. We're just, I used to say crazy, we are just courageous enough to bring them home and love them the way we love them and keep them alive. Long answer. Sorry.
The next question, thank you for answering that question. The next question is for Kieth. In what ways do you think or know we can eradicate racism, bias, discrimination, and the control of our health?
Thank you for the question. I think this is a complicated question, but I think the most important general framework to understand is that we have to create race-specific policies and solutions. Here's what I mean by that. A lot of times we talk about ideas, which I support, which are basically progressive ideas, expanding access to healthcare, making sure that we eliminate sort of structural barriers that may prevent people from having access to healthcare. We talked about Medicaid expansion, I think someone mentioned in the South earlier. All those things are very useful and important because disproportionately Black people will benefit. People of color, especially, but Black people will benefit. But the problem is that when we create policies that inure to the benefit of society as a whole, they don't necessarily eliminate the racial disparities in society. And so if you think of an example of this way, if you have a cruise ship and a canoe, and they're both in the same ocean of water, and there's a whole saying that a rising tide lifts all boats. So if you put a rising tide into that water with a cruise ship and a canoe, you're going to get a different outcome from those two different boats. Yes, the tide will be higher for both of them, both will be lifted, but it's not going to lift those people with a canoe into the cruise ship. It's not going to give them the relative comfort of living in the cruise ship. You're still going to have a disparity. If you give everybody $100, that may be a good thing. But when you have a structural barriers in society where white people are already wealthier than Black, where white incomes are wealthier than Blacks, in cities like Boston, where the average, this is an actual number from the Boston Globe a few years ago, where the median income for Black families in the city of Boston, Massachusetts, was $8, not 800, not net income, I'm sorry, the median wealth, not net wealth, was $8, not 800 or 8,000 or 8 million, $8. And when you have disparities like that, you can't have economic solutions or healthcare solutions that just focus on providing access for everybody. You've got to create race-specific policies. So when we talk about reparations, I think we need to have reparations in healthcare. We need to make sure that our healthcare inequities are dealt with. There are specific issues that Black people deal with in our healthcare. We know that Black people are disproportionately affected by HIV/AIDS. We know that Black people are disproportionately affected by sickle cell anemia. Black women are disproportionately affected by fibroids. We have all these disparities that we're aware of, and yet we don't dedicate resources to those things. And so part of it is breaking up the mentality that we have to have universal policies and start to create race-specific policies that target the communities that are most in need.
The next question, thank you for answering that, is for Ashley. While GALAEI has always served the entire LGBT community, many queer and trans people are concerned that GALAEI has lost its Latinidad identity that was established as a safe and cultural affirmative and linguistically affirmative safe space for LGBTQ Latinx. How will you alleviate these concerns?
Thank you for that question, Viviana. Can everyone hear me okay? Excellent.
Yes.
So it is incredibly important that as we evolve to wrap our hands around all folks of color and take care of our siblings, of all folks of color, that we stay rooted in our foundation. It is incredibly important that we honor and uplift the Latinx siblings that have created GALAEI, that have put in the work and love and effort to make sure that we could grow and take care of one another. So we continue to have specific initiatives for the Latinx community. It's also incredibly important to us that our staff remains bilingual. So 86% of our staff members are bilingual, 86% of our staff members are Latinx. And as we grow and bring on more folks of color, we have 2 brand new deputy directors who are Black. And it has been an incredible, opportunity to watch the divisions really being broken down. We're watching the building happening in our communities in a microcosm inside our organization. We are watching how when we work together as Black folks, as Latinx folks, as we're bringing in Asian folks of Middle Eastern descent, we are watching how much that impact ripples throughout the community and how positive it is. We are not letting go of any of our roots. It is incredibly important to us that we remain for and focused on the Latinx community. We have new initiatives that are coming up that are specifically in Spanish. And those initiatives are led by our staff members who are Latinx. I am not Latinx, and it is important that when my staff comes to me and says, we would like to create a new initiative, my responsibility is to say yes and figure out a way to make it happen. I am not a gatekeeper I'm a gate opener. So that means I will go out and find the funding. I will go out onto the street and talk to people. I will contact my personal contacts to make sure that we are continuing the initiative and that we are creating new initiatives specifically for the Latinx community and for our other siblings of color, creating new opportunities to build the bridges because we actually are stronger together. So I absolutely understand that concern, and I would be concerned as well. I thought about it coming into this space initially. I thought if this was historically a Black organization and we were shifting to embrace all folks of color, how would that impact me? And then I thought to myself, this is bigger than me. This is bigger than my own individual identity. White supremacy is a beast that is infused in the soil of this nation. They have stolen, white folks have stolen from us our histories, our strengths and abilities to make active change. And so it is now our time to come together and focus on one another. It's our time for my Latinx siblings to stand with me in protest for Black lives. And it is my responsibility to stand with my Latinx siblings to say it is wrong what is being done to trans women at the border. It is wrong, and we will make the changes necessary. I will put my body on the line. I will stand in front of my Latinx siblings because I have privileges in certain areas that you may not. So we must do this work together. We won't be losing anything at all. We're just going to grow, and we're going to be stronger together.
Thank you for answering that question. The next question, it's not specific.
Can I just say hello and goodbye on that one? Hello and goodbye. Thank you, Ashley.
The next question, it doesn't seem specific to anyone. It seems to be general. It says, just looking for perspective. How do we sustain the funding at a high levels? Often there's an event or a catastrophe that leads to initial investment, but then that can slowly be eroded. Over time, bureaucracy and secrecy, changes in political priorities. How can we support Black leadership when we are often called in to clean up the mess of some other, usually white person?
Wow. I'll say something first. I think the first thing I'll say is we need more Kieth. We need more Kieth Boykins. Part of it is getting folks to the table, right? We know if we're not at the table, we're likely to be on the menu. So we need to get folks on the table. And then the other thing is we have to stop celebrating responses, especially fiscal responses that we think are wonderful in the moment, right? Like, you know, one of my favorite quotes is like, the problem with most people is that it's not that they aim high and miss, is that they aim low and hit. And, you know, we are okay with that. We are okay with accepting mediocrity and saying, oh, this is great. They did this for us. They did us a favor. We have to watch language. We really do. We have to watch how we present these things and how we accept them. Stepping in and fixing something after it becomes a big problem is not the answer, right? We know the answer is here. I'll say this and wrap up. Years ago, late 90s, I'm driving through Brooklyn with some researchers, and we stop at a light, and the person goes, oh, that's PS something, forgot the name of the school. And this person turned to us and said, you know that the kids were playing in the schoolyard, and he said, 8 out of 10 of those kids are going to prison. And I couldn't move the car. We knew that. We know 8 of 10 of those kids are going to prison, and we're not going to do anything till they go to prison. I'll stop there.
So I have a question well, I see a hand up. Michael, I actually have a question for you as well. So I'll let you go and then I'll ask you the question. Is that okay, Michael Chancley? All right, we can't hear you, by the way.
Perfect. Okay, so I think I just remember during the George Floyd protests in 2020, we started hearing, especially within the HIV field, that racism is a public health issue, and I just know that was something that all of the agencies released statements and they did diversity and inclusion trainings. I think just to kind of answer the question with how do we support leadership and how do we get those funds, I think we just have to not let up. I feel like a lot of those conversations, when the protests died down, the conversations died down. We didn't see a change in leadership. We didn't see a reallocation of funds. We didn't see a change in strategic planning. We didn't see a difference in the board makeup. So I just want to know, like, I guess I'm answering the question where the question is, where is all of that energy when we were burning things down? You know, like we got all of these promises, both on a national level, but in our own smaller, like, public health field, specifically with sexual health, HIV, reproductive health. Just want to know, like, where did that energy go and why did we let up? Because we were ready to, like, make these huge changes, and just that like, it just didn't go anywhere. So I guess to answer the question and kind of maybe even rhetorically ask that question is, like, you know, we have to keep putting that pressure. We have to say, where is the change in leadership that we were promised when everything was on fire? Where is that reallocation of funds? Where is that, you know, we said we were going to go beyond just the traditional diversity and inclusion trainings and really try to dismantle systems of oppression and systems of racism? Like, what happened with that? Because it seemed, I mean, and I know we had an election, we had a pandemic, we've had a lot go on in the last 2 years, but where did those conversations go? Where did the tangible, like, where did we see any kind of tangible change? Because it kind of just seemed like everybody just returned as the fires died down and more problems came, everything else just kind of died down. Like, we just have to keep putting that pressure on and keep asking the question and keep demanding answers to that question.
Got it. Thank you for that, Michael. I wanted to ask you something specific to your work, Michael. There is still a lot of community, some misinformation, some disconnected, and concerns about PrEP and or access to PrEP. How do we address this in our communities? What does community control look like in this conversation? And certainly there are others who might be able to speak to this as well. But Mike, since this is your specific line of work, I wanted to hear you address some of those issues that folks continue to have about PrEP and access to PrEP and whether we should do it or we shouldn't do it and all of those things.
I think we need to make sure that we are in control of the messaging. You know, I know a lot of the conversation we're having right now is about changing the systems, but I think also controlling the messaging as well. You can't have somebody from, you know, I mean, I'm a Black gay male in the South. I'm older now, so I have to. I try to slip young in there. I'm like, oh, I can't say that anymore. But but I'm a Black gay male from the South, millennial, and definitely I know that all of the messaging that's out there around PrEP is not going to resonate with the faith community. It's not going to resonate. What might resonate with somebody in New Orleans may not resonate with somebody in Atlanta, even though, you know, we're all still the South. Like, so I think definitely in order to, you know, and that's one of the reasons why I like to use myself as an example. I always tell people, I remember being at a conference or a summit and somebody asked a question. It was like, why are all these people speaking, but nobody's telling us about their personal experience on PrEP, you know? So I always like to let people know, you know, from the day I started, you know, I've been transparent on if I would have side effects or not. I've been transparent on, you know, just with my community, whether it be a client or whether it be a friend or social media. You know, I'm transparent, like to let people know, hey, I've run into stigma with my provider. I'm knowledgeable. You know, I know how PrEP works. I know, you know, all of the information. And even when I walk into a provider's office, I have to deal with stigma and judgment and biases and things like that. So just kind of self-advocating for myself, but also advocating for my, I feel like in doing that, I'm advocating for my community. Like if you tell me the wrong thing and I know it's the wrong thing, I definitely want to make sure I'm correcting you and make sure that you're not repeating that misinformation or having that stigmatizing or judgmental attitude with the next young, again, take young out of that, but next Black gay male that walks into that office, who may not advocate for himself, who may not have the same information about PrEP. A lot of times people are walking in and may not have even heard of it when they walked in the door, heard very little about it. So you're taking that medical provider or that patient navigator's word as fact. So just making sure that I'm putting the right information out there, making sure that my community is getting the right information. If I see a poster or a flyer or a campaign that I feel like is stigmatizing, or if I know somebody in the field is doing stigmatizing things, can't just like hold my head down and not say anything about it, for fear of ruffling a feather or something like that. And that was something that I had to learn. So just making sure that people are not just getting the right information, but getting information that's tailored to their community as well. Again, we know the South and the West Coast and the East Coast, the way you present PrEP and talk about PrEP is going to have to be completely different. So
Gotcha. Thank you.
Sorry, Mike.
No,
So there is a question from the Philadelphia Gay News. How have the conversations between the Black and Latinx Community Control and the Philadelphia AIDS Activity Coordinating Office been going? What has resulted from them?
Can I take that?
Absolutely. And you have your hand raised, so.
Okay. I know, like y'all ignored me, right? Anyway, going back to the initial question about funding and things like that, that is, I forgot who asked that question about they were curious about the funding and full funding, blah, blah, blah. This is actually how Black and Latinx Community Control was founded. Initially, there was money sent by the federal government under Trump, of all people, which I was highly suspect of when I found out that they made this money available. Then I found out it was people on the inside that made it happen. He just slapped his name on it. And it's called End the HIV Epidemic, which the money was supposed to be directly for our communities. And immediately it hit me like these larger organizations are going to get the lion's share of this money. The Philadelphia Plantation, that we all know is something else, Mazzoni, and a few others. And while small organizations like GALAEI and Colors are like constantly underfunded to not meet the need, but serving the most impacted by HIV and AIDS. And that's because they never received, over the years, they never received the same funding, were able to build up their organizations like the white organizations could. So this is why they're not as powerful and have the reach that the other places have been, these legacy organizations have been around. So it all ties in together. In fact, our group first started with Nick Lopez, that I see drinking a cup of coffee right now. Members of the Black and Brown Workers Coalition, which was Abdul and Shani, folks, and we all worked together and came up with Black and Latinx Community Control. And we demanded meetings with the health department about this money. And our relationship, it's a working relationship that they understand that we as a community have what we need. We want to keep these conversations ongoing. We want to make sure that, they're funding these symposiums for us to talk about these issues. We want to, hopefully we will get continued funding to have these symposiums, but I think they understand. And there are people that are working at ACO that are also Black and queer that get it, and they're from this area and they actually understand. So we have their ear, and we're going to continue doing that. But I just wanted you guys to know that's how our group started was behind the funding for EHE, and it wasn't that great deal amount of money, but the amount of money should not be going to organizations that don't serve our people in the way that we are culturally competent to do. You know, I'm an old AIDS activist, old battle axe, so I know how to fight for money. I know how to fight for justice, and we all came together. Our first symposium was all Black, all Latinx, and we all came up with the same conclusion of white supremacy is generating HIV infections in our community. So I just wanted to add that.
Thank you, Jose. I earlier saw, I believe in this order, although now it looks like Kieth has taken your hand down, but Kieth, I saw your hand and then I saw Ashley's hand. Kieth, do you still?
Well, yeah, I just wanted to respond to something that Michael, the other Michael said about PrEP, about sharing our stories. And I'll share that when I first heard about PrEP some time ago, that I was one of the people who had some concerns about it, about how it might be used as an excuse to sort of justify other types of unsafe sex. And over time, my concerns, some of them have been addressed. But I was talking to my doctor about PrEP a few years ago, and my doctor recommended PrEP on demand, which is something I'd never heard of before. But I didn't like the idea of having to take a pill every day. And so he suggested that I might consider doing that. And so I've been using it. I haven't been using it consistently, to be honest, but I have used that. And I've found it to be an effective tool as well for people who don't necessarily want to go through the route of being committed to PrEP all the time. I don't know what the community consensus is on that, but my doctor's gay, and I thought that was important. I wanted to have a doctor. All the doctors I've had in my life have been either Black or gay or both, because I wanted to have doctors who understand me and reflect my sense of community and values. And my doctor was the one who introduced this idea to me. So I think part of it is just having a conversation with our healthcare providers and choosing healthcare providers with whom we can have honest dialogue. And so I'll leave it back to Michael to tell me what the consensus is on PrEP on demand, but I have found it to be a useful solution for someone like myself.
Thank you, Kieth. Ashley, I know that GALAEI actually has a PrEP program, right? I'm right about that, right?
We do. We partner with other organizations to provide PrEP, linkage to care, HIV testing, STI testing. And we, as you know, I've really uplifted many times, we are all about partnership and doing things collectively. So we work with Babashi. We work with Colors. We work with the other organizations that are focused on our community, on our people, because we really do believe that we are the ones who are most capable of taking care of our people. I did want to make one quick point to Sterling's question earlier around supporting Black leadership. And it's actually a call to action for white folks that are currently allies and would like to be accomplices in how you can support Black leadership. And one of the largest ways that folks can support Black leadership is when there are no Black or brown bodies in the room, uplifting initiatives that are done by Black and brown leaders. When there are no Black and brown bodies around, have those conversations with your fellow white cohorts. Give credit to Black and brown leaders in the moment, not in your head, not 6 months later, not in an email. Say it out loud in front of your colleagues, even if it makes you a little bit uncomfortable or it makes you not the favorite in the room anymore. I promise you'll still be part of the boys club. It is incredibly important that white folks, although we will keep pressing and we will keep fighting, if you want to be an active accomplice, if you want to be part of change, if you want to be on the right side of history, then it is important to be having these conversations, listening and learning from Black and brown leaders, and taking them into your own white communities and pushing back on the systems of white supremacy in your own communities, with your families, with your friends, and with other leadership. Also, buy Black and Brown owned and donate to Black and Brown led organizations.
Say that last one again, Ashley. Donate to who?
Buy Black and Brown owned and donate to Black and Brown led organizations.
Yeah.
Hey, so in this symposium right now, we have GALAEI, who you can absolutely donate to, and you can ask your friends and your social networks to donate to GALAEI. You can donate to Colors and ask your friends and your social networks to donate to Colors. You can buy an awesome book that I'm not going to tell you the name of, because right now, Jose wants to give away a book by Kieth Boykin. In the way that we're going to give that book away, this first book, we're going to give multiple books away today. The way that we're going to give that book away is by having you answer a question in the chat. And the first person to answer the question in the chat will get a copy of the book. You should leave, and I'll ask you to leave your name and your address once we know who the winner is. So here is the question. Please name Kieth's latest book. Kieth's latest book, and place that in the chapter. The first one to put it in the chapter is getting a copy of Kieth's book. I'm in the chat. The name of Kieth's latest book. Okay, there we go. There we go, Kieth. Micah Thomas. Micah, hey, Micah, it's good for you to be here. Thank you for being here. Micah Thomas. Oh, wait a minute. I'm sorry. Jill, my apologies, Micah. So I'll do this, Micah. I'll get you a copy of Kieth's book myself, since I messed that up. I'm not gonna, I'll do that. And so it is actually Jill. Jill, thank you for answering that. The name of Kieth's latest book is Race Against Time. Race Against Time. And Micah and Jill, if you would please, you can direct message Jose with the name, with your address, and we will make sure that you get a copy of Kieth's latest book, Race Against Time. Thank you for that. And speaking of racing against time, I should let you all know that we are 2 minutes away from the next session, which will probably allow us to get a few minutes of space in between there. We are right now supposed to be in a breakout room, or breaking just for a conversation about, or for a brief conversation about the book. I want to share with you all. James, I can have screen sharing capabilities, right? Awesome.
Sure. I don't know how to do that myself. I'll let you figure it out.
Can I just say something quick while you do that? Just very quickly, that was my daughter who won. And I was going to tell Kieth earlier, my daughter's like, oh my God, Kieth Boykin's on with you. And she's texting me like crazy, and she joined. I am elated. I'm so excited. Jillian, my daughter, who grew up with me in this work, who is just an amazing, amazing kid, but not a kid. That was just perfect, because I had my hand up to say that. And then when you said Jill R., I was like, I went nuts over here, so thank you for that. And then I wanted to make one more point if I could, but let me know. It's very short.
Okay, I'm having trouble sharing, James, but I'm going to send you this link, James. And if you could play this link, it's a link to Kieth's introduction of his book. James, can you just play that link for us, please? Thank you.
This is Jose again. I'm sorry to jump in here. When I was corresponding with Kieth over before the symposium, we had we had actually thought that this was going to be an in-person book signing, and I had no idea how to do an electronic book signing. So we just decided to make sure that there were books available that we could give away to folks. So Kieth, I have no idea how you would electronically sign a book that you don't have. And we don't have, but we're doing this through one of our sponsors, Philly Aide Thrift, that is also owns Giovanni's Room. So we've ordered, the books are being ordered through them, and they're going to mail out the books to the winners. So you may not be able to like sign anything unless you want to sign a piece of paper and send it to people. I don't know. But I can't think of any way you can like electronically sign the book and, you know, send it, especially since you're not here. So sending you to a breakout room, you know, we could really use you in on these conversations, Kieth, seriously.
I just left and went to the breakout room, but there was nobody there, so I came back here. There were people there, but I couldn't see them. There was like 30 people there, but I couldn't see how to interact with them. So I don't know how to use this technology. Somebody has to guide me through.
Yeah, I think we should, James, if we could play the introduction to the book now. And Jose, one ideal for, you know, if we really want to, and I think it'd be awesome to have Kieth sign the books, is to have the books sent to us initially and send the books to Kieth in New York, have him sign them, and then we can pay for postage to get them back to folks here. I know that's a little bit of more money, but I think that it's worth having Kieth's signature on the books if it can happen that way.
Well, the other thing we do is we use something called book plates in the publishing world, where it's a little plate that goes inside the book. I sign it and I send it to you, and you can put those in the book. Or I can send it to Giovanni's room. Giovanni's room may actually have some because I was there for a book signing last year. So that's usually the way to do that, and it goes right inside the book and looks like it's a signed book.
Awesome. So we'll investigate that, Jose.
Okay, that sounds.
James, can you play the introduction to the book, please?
I'm getting an invite to join the breakout room. Should I join the breakout room or stay here? Okay.
I'm Kieth Boykin. For the past few decades, I've been an eyewitness to history. It was 5 days after George Floyd was killed, and I was on my bicycle in New York City covering a Black Lives Matter protest. As the marchers moved down the West Side Highway, I stood on the side of the road between the police and the protesters.
They said they were going to arrest people. I said, I'm with the press. They walked by me, then they turned around and they arrested me anyway.
I'm Kieth Boykin. For the past few decades, I've been an eyewitness to history. It was 5 days after George Floyd was killed, and I was on my bicycle in New York City covering a Black Lives Matter protest. As the marchers moved down the West Side Highway, I stood on the side of the road between the police and the protesters.
They said they were going to arrest people. I said, I'm with the press. They walked by me, then they turned around and they arrested me anyway.
I was one of 14,000 people arrested in protest in the month after George Floyd was killed.
Why am I under arrest, sir?
My experience covering those protests in the summer of 2020 convinced me that America is in the middle of a cold civil war.
He vowed to accelerate the collapse of civilization using violence, mass murder, hate, and threat.
In my new book, Race Against Time, The Politics of a Darkening America, I explain how political leaders in both parties have failed to prioritize racial justice in America so that white America can have a sense of peace.
This is my land.
But any society that consistently prioritizes peace over justice will soon find itself with neither. I believe that to truly save the Union, we have to fight racism, sexism, xenophobia, and homophobia, and not just make Black lives matter, but make Black lives equal.
Hachette.
Thank you, James, for playing that for us, and thank you, Keith, for sharing the intro to your book. We're very excited to be able to share it with some lucky folks who are paying really close attention to everything today that our speakers are saying and being quizzed on it and answering questions. Vivi, where are you, Viv?
I am here. Can you see me and hear me?
Yes, I can hear you. This is bringing us to the close of this session. I feel like I need a 5-minute water break or something.
I agree.
Anybody else need a 5-minute water break? Hey, Brandon, I'm sorry, before we go, Brandon, something that was on my mind. We're talking about messaging and messengers around PrEP. And I remember some time ago, a lot of folks was having conversations about research not really reflecting the people who it was intended to reach, not being done by people who it was intending to reach. You're a Black researcher. Has that changed much? Are you seeing any change in who's doing the research and how it's really reflecting the values of people who look like me and you?
I'm going to say it's a work in progress. So my former job, when I was working at NYU, my boss, he was a lead researcher, investigative researcher, and he was a Black gay man. Definitely not common, but it's slowly getting into place. So we're seeing a lot of outreach work and getting more, Black and Latinx people of color to get in research and not just doing the actual outreach, because we all know that who's doing the community outreach is always going to be a person of color. No surprise there. What is a better shit is we're seeing more people that are coordinators, researchers, actual people in the CDC. They're not just partners, but actually CDC members. So I've met with a couple of Black researchers from the CDC. So it's a work in progress, but we need a lot more. Because like I said, when we're talking about from an activist perspective, people are on the front lines, but a lot of times the work being done in the back rooms and the higher ups, there's not many of us. So a lot of times when I'm in those spaces, I have to really be very mindful to bring both worlds together in the same space. So it's always very interesting conversations I'm always having with researchers from different research institutes and also governmental workers as well.
Brandon, was your peer at NYU Patrick?
No, I don't know if you know him, Dustin Duncan. I can refer you if you know him not, but he was my former boss.
Okay, Dustin. Yeah, I think I know Dustin.
Mm-hmm.
I think Dustin went to Pitt, University of Pittsburgh.
I know you're talking about, but that's not him. No, Dustin went to Harvard.
All right, I'm gonna stop making all the wrong answers. Okay, so Viv, do we need a break, Viv? I think we need a break.
Yes, we do. I need to go to the powder room and get more beautiful.
So we're going to take a 5-minute break, folks. The time is 11:45. We ask that if you can come back by 11:50, that would be awesome. And we will go right to the next presentation. Thank you to all of the speakers for sharing your thought leadership and your work with us this morning. It has been awesome, awesome, awesome. Or as I say in my country place, awesome sauce. Thank you for being here, and we look forward to your continued work and leadership in our communities. Thank you so much. 5 minutes, 11.
Stop by later.
So I think we are ready to get started. Are we, Viv?
We sure are.
Jose, are you ready to get started?
Ready as I'll ever be.
Well, we know that's ready. James, are you able to bring up Jose's presentation? Yes, it is. It is there. What am I doing? Jose, you want to get us started?
Yeah. I can't quite bring this up on my phone for some reason. Give me a sec. It's like 2 minutes. Here we go. Okay, you all guys know who Black and Latinx Community Control is. Next slide, please, James. Do you want me to read this aloud while we read silently together, or do you guys just want to read this?
I think we can read it silently.
All right.
One of the translators is having issues with getting back into the main room.
Maybe can you handle that for us?
Yes.
Hey, Vivi. In order to save time, do you think you can verbally translate this? Do you feel like it? I know we have people paid to do that, but it's up to you. Oh, okay, great. Let me know when they're done so we can get to the next slide. Okay. We can get to our grounding exercise now. The next slide. Okay, folks, everyone, we're here to have honest and frank discussions about HIV, queer and trans people, and white supremacy. Is that okay with everyone?
Yes.
Okay, we know in Philly. Next slide, please, James. We know in Philly, HIV cases remain high among queer and trans people of color. Next slide, please. These are people of, oh, what an awful picture. That's me sitting.
Now, Jose, that's not an awful picture.
It is like
you were out protesting all day.
I look like, I'm sitting on my steps in North Philadelphia, like watching the gentrification across the street from my house, but that's another story.
And I can tell exactly what you're thinking. Get out of my neighborhood.
Get out, colonizers, get out. Yes.
They need to leave, that's for sure.
Yeah. Next slide, please. Okay, these are our objectives today. Like, what is the history of Black and Latinx community control? What's happening? And let's do some brainstorming. So, Mike, you want to give a history of the history of Black and Latinx community control, please?
Ooh, how'd you lay that on me? Okay, just threw that out there on me. I'm sure there's some other folks who can help out with this. And I see that Sterling Johnson has to jump off. Thank you, Sterling, for helping with this presentation. So appreciated.
Thank you, Sterling.
And sorry you have to leave so early. Sorry you have to leave so early. But the history of Black and Latinx community control. I mean, I shared just a little piece of it earlier on. I mean, it just goes so much further back than even Colors and GALAEI. I could tell you that there were groups in the 1950s here in West Philly called the West Set. And they were a group of mostly Black and probably at the time not out publicly about their sexual orientation and gender identity, but they were having conversations and parties in houses and in other places that they would rent out. And it really sort of, I mean, just to be very clear about it, when you think about Black Pride, the Black Pride movement in Philadelphia today, that really started with them because they did most of their organizing around pen relays. The West Set, Ricardo, and all of those folks, Joe Myers Brown from Philadelphia, and all of those folks who used to have those parties in West Philadelphia and do some organizing in West Philadelphia. But certainly for what we really, what we recognize today as like the formal organizing, there is We the People. That was an organization that started. There was another organization, Jose, I can't exactly remember the full name of them, that Tyrone Smith, who is one of the, well, certainly Unity, but even before Unity, there was a group before Unity. But Unity, as Jose said, was a group founded by Tyrone Smith and a bunch of other Black gay organizers. Certainly my good friend David Acosta and GALAEI was very, very early on in organizing in Latinx communities, and of course there's colors. There have been a number of, very specific, folks who have maybe not even formally had organizations, but, I just call into the space Jackie Adams. I call into the space Shay Clark. I call into the space Charlene, who was a really, really inspirational and transformative leader in our community for a whole bunch of folks, but definitely as it relates to trans-related issues in our community. There is, Philadelphia has a very deep history around Black folks and Latinx folks organizing. I'm thinking of my friend who I also call into the space, Gloria Casares. And certainly, Gloria is legendary for her work in Black and Latinx communities around LGBT related stuff, around HIV related stuff, but also very, very, very legendary around with her work just for poor people across the board, housing for poor people across the board. My friend Gloria Caceres, I call you into this space today, and I welcome any of the folks who are on the call in this symposium to also list some of the names of folks who have done organizing in Black and Latinx communities, and particularly around organizing around community control for our communities. So let's see if we can put some of those names in the chat box that you know of, and not just folks who have done organizing in Philadelphia, but folks who have done organizing across the country. I'm reminded of, so Marilyn put in Joaquin Rivera. I'm reminded of Dr. Rashida Abdul Kabir, who is a Black Muslim sister who started Bibashi, one of the first organizations that responded to HIV in the Black community, and did some very great organizing work among Black and Latinx communities very, very early on, Dr. Rashida Abdul Kabir. Interestingly enough, this Dr. Kabir is a infectious disease practitioner, and she went into a club here in Philadelphia, a Black gay club called Smart's Place. And she went in there as a Black Muslim woman and said, listen, people who look like you are dying of HIV alone in Einstein Hospital, and we need to do something about it. That's how much courage and that's how brave she was as a Black Muslim woman who cared about Black and Latinx communities, for her to go into a late night Black gay bar, which really was a hole in the wall, Jose. I'm sorry for saying that, but Smart Place. So I call Dr. Kabir's name in her work into the history of Black and Latinx community organizing. Nick, thank you for raising Jackie Adams. Jackie, unapologetic. And if we never see another unapologetic person, all we have to do is remember Jackie Adams and ask for her wisdom and her strength and her courage to be that voice of being unapologetic about what needs to happen in our communities by us, for us, and what other people need to do in terms of stepping out the way and letting the Jackie Adams of the world stand up and say exactly what needs to be done and how it needs to be done. She was not afraid of me. She was not afraid of you. She was not afraid of anyone. And she would not let anyone stand in the way of the message, the important messages that she brought, and the courage that she brought with those messages. So if you ever need any inspiration. Look her up. Look up Jackie Adams. Look up what she said. Look up what she stood for, and stand like Jackie. Stand like Jackie. She would oftentimes talk about her own history with so many things and what she was able to transform for herself and what she wanted to transform for our community. She was a phoenix rising for our community. Jose?
I don't. You had mentioned the Smart Place. That's a place I've never frequented. It may have been before my time, Michael, but I'm sure you remember.
Yes. And you know what, Jose? And folks, I mean, when we think about this, a lot of organizing. So, when we think about organizing, particularly, Black and Latinx organizing, we don't have to think about, just about those formal places like Colors and those formal places like GALAEI, who are historic and have done some amazing work, right? But organizing happened in kitchens. Elliot Prescott got together with a group of his friends, including me, and said, we need to have something, a magazine like Colors, to represent the voices of Black and Latinx LGBT folks. That happened in Elliot's kitchen. The organizing that Dr. Kabir did happened at Smart's place, right? And it's happened in so many places in our communities. And we have to remember that is where, when we talk today about meeting our communities, where our communities are, that's where we are. We're right in our communities. This kind of organizing doesn't always happen, in some fancy brick and mortar location with a plaque outside of it or a bunch of awards on the inside of it. It happens in our communities by everyday community folks. I remember there was this one, I can't remember her name, but she was a block captain in North Philadelphia. And you could go to her house, no matter who you were. You can go to her house and get condoms. You could go to her house and get information about saving your life and the lives of those who you loved, your peers and your families. And you could just walk up to her door, knock, knock, and she knew what she was there for. Her nephew was a dancer with the Arthur Hall African-American Dance Ensemble, Curtis Redding. I've called his name into the space, who passed away some time ago from HIV, but call his name into the space too. Jose?
Yeah, I was just, my mind was going back. Michael, what was the name of the group of guys? They did social events like once or twice a year. There was one they held at one of the museums. They had boat rides on the Delaware, and it was more or less a social group. But these were all a group of gay Black men that gave these big social affairs once or twice a year. And I cannot, for the life of me, think of the name of this group of guys. And one of the guys that was like one of the members, he worked at Temple. He was a light-complected guy. I can't remember his name, but that was. And for those of us that got tired of going to the same bars all the time or the same clubs, or did not want to patronize certain clubs, this was really a way out and a way of like meeting and greeting and keeping community. And I can't remember the name of the group.
I cannot remember the name of the group either. Thank you, Ed, for bringing Adodi into the room. Yes, Clifford Rawlins, my good friend, Clifford Rawlins, Adodi, bringing Adodi into the group. Jose, I can't remember the name of the organization, but I know my Tony Morris, who I'm actually texting right now, to ask him what was the name of his group that used to do the boat ride and do the parties at the African American Museum. I'm texting him right now, asking him that question. Maybe he'll be able to answer. But let's move on, Jose.
Yeah, I was also thinking of all of the folks that came out of We the People, and I forget the name of the brother that did a lot of spiritual stuff for Black gay men with HIV. He passed away. I remember him well. He was oh, my
Hal
memory-
Carter.
That's it, Hal Carter.
Carter.
I want to bring Hal into this space. I want to bring
And his
Curtis
partner,
Jenkins.
Kevin Green, who is still living.
Wow. I also want to bring up Curtis Jenkins, that worked at We the People, that was the director there for a while. I think Jenkins was his last name. My memory is so bad. And this is some of the things our community has done, how we come together, how we support each other. And in fact, I just said this earlier, this is how community control came together. It was in my kitchen. It was literally in my kitchen. And Nick Lopez was there. A lot of folks were there. A lot of folks that were in the very beginning are not there now. Some folks didn't think it was proper because they did not have HIV, but this is how stuff happens. So yeah, like, where are we now? You know, Blackwells of West Philly. What was? I'm trying to read the chat at the same time. Oh, one other thing I wanted to bring up too. There was one of the first and only, at the time, the only Latinx queer club bar. It was called Las Villas, and it was at 5th and Venango, if I'm not mistaken. If anyone on the call remembers that, I would, speak up. And it wasn't very long, but it was one of the only all queer Latinx clubs during that time. I believe this was, it was over 30 years ago. But it was amazing because it was in North Philadelphia, and it was a place for a community to come together and socialize with each other, because there was nothing like that ever before. But with all of that history and all of this organizing that we have as a community, because I really believe as a community of people of color, I believe as a community of people that are oppressed for being queer, stigmatized for having HIV, we are fucking resilient. We are a resilient group of people. And this is why the symposium is happening. So I think that's a little bit of what I remember of our past. Does anyone can think of anything from my history?
Samuel Morales.
Oh yes, Sam Morales.
Samuel Morales. He was Samuel Morales. He advocated for Blacks, Latinos, queer folks, and whatnot, and he was great in the community, well known in the community.
He really was. Sam and I had started a little small organization called Proyecto Sol. And it was we were the strangest bedfellows, because I'm about as, they say, queer as a $3 bill. And Sam Morales was how can I say, aggressively heterosexual. And Sam had served a lot of time in prison. And he was rough as they come, with a heart of gold. And he and I were like brothers until he passed away. I'll never forget Sam Morales. He did a lot of community work. He loved his people. He loved Boricuas. And he fought for Boricuas that are living with HIV for better services. Between Sam and I, we resurrected Project Teach Latino when it was completely forgotten and not funded. And we were able to restart those classes. So yeah, Sam Morales is really something. I was looking at the We the People publication that Sterling put together for us on a slide. And We the People, I remember ACT UP when Ed Rendell attempted to cut Medicaid funding, especially for people that were living with HIV. And this was a group of folks, all Black and Latino, seriously. and act up. And we chased Ed Rendell down the street, down an alley, because he was trying to duck us and hide from us. And we embarrassed him at a fundraiser really, really badly. And he eventually met with us, and he decided not to do that, to revert, not to take funding away from people with HIV for our medication and treatment. So this is like some of the small things that community organizing actually does. Our community organizing was able to get somewhat moderate increases in funding for GALAEI and also colors. This is what community, Black and Latinx community advocacy has done, because we wanted money to go to small organizations serving our people, but it's not nearly enough. It's not enough to meet the need. We need to be organizing more. We need a lot of folks that may not be for our community to be standing up and working with us and helping to dismantle some of this craziness. Like, you need to be helping us with this stuff, you know? We use every drop of energy we have. We use our T cells. We use a lot of things. And be honest with you, this change is so slow, and I'm like fucking tired of waiting. You know, I'm tired of waiting. I'm tired of people telling me to wait. You know, it makes me angry because we've been waiting 400 years as Black folks in this country. And I keep saying that, and I keep reiterating it. 400 years is a hell of a long time for us to have progressed into having voting rights taken, you know, suppression being instituted, from historically Black colleges all getting bomb threats at the same time. This is what we have done. This is where we have progressed in 400 years. I mean, we can all lay it at the foot of Trump, but we also have to remember all the good people in the world that are doing nothing. I mean, nothing. There's nothing worse than good people being silent. So anyway, I'm sorry, I went off on a tangent here. So maybe we should talk about where we are now, which I think I did a little bit. But what do you guys think about where are we now with the organizing? What should we be doing?
And Sam has his hand up too.
Oh, go ahead, Sam.
Yeah. Just like Jose said, I'm tired too, and I want to raise the names of Jose DeMarco and Michael Hinson. Why wait? Why wait to acknowledge you guys, you know, years from now? You're in it right now. We need you. We need your energy, your frustration, you know, all that passion. So I wanted to raise you guys. I mean, it's now. It's now. Too often we wait, you know, till later on and then go, yeah, those guys were really good. Those guys are great right now in the moment. I love this. I just want to take a moment to thank you again, man. This is like, with just too much of a disconnect. I'm a quick ride down the turnpike, man, to Philly. So I'm gonna pledge this. If there's anything I can do, anything you're doing, please let me know. Let's get together. Let's bring more people to the table. I'm looking to doing this in person next year. I want to meet you. I want to hug you guys. I want to hug everyone here. Like, let's do this in person. You guys are beautiful. Thank you all. Thank you, everyone on this. There should be 400 people on here to match a year, you know, one for each year, Jose. But yeah, I just want to raise you now, man. I'm not going to wait. Let's do it now. And again, if there's anything I could ever do, please let me know, because I'm starving. I'm starving. And I'm looking forward, you know, we used to say in HIV, I'm looking forward to this day. And then maybe 15, 20 years into it, I didn't see it. And I'm in it. So thank you again. Thank you both. And thank you, everyone. Just want to take that moment.
You know, and we lift you up too, Sam. You know, you are you're incredible. You're the director of the first legal overdose prevention site. I don't know how many Boricuas or Latinx folks you serve, but it's amazing the lives that will be saved. Why we can't do this in Philadelphia, I don't know.
Not yet.
We've been trying. We've had a mayor that we have a mayor that paid a lot of lip service. So you know what you can do with lip service, right? We've had, you know, some folks that stretched the truth and exaggerated a lot of what we were trying to do. And I can't understand why people would fight against saving lives. There has to be a way to do it. There has to be a way to do it. People are dying all over, not only in one section of the city, they're dying all over this city. There needs to be something in place for everyone to start saving lives. Our lives are worth living, because people are Black or Latinx and on drugs. You discount their lives? No, there's not enough compassion for drug users, not nearly enough. And we as a community, that's another conversation we should be having, is how we ostracize or look down on people that use drugs. And that's because a lot of times people on drugs have done some really screwed up shit to their families, to their neighborhoods, but still, they're still your family. They're still Black, they're still brown, and they live, and no one talks about the systemic racism that people live under that drives people to use drugs, that makes people depressed, people can't get jobs. No one talks about this stuff. There's no compassion, there's no compassion. And it's always pull yourself up by your bootstraps. Everybody doesn't have boots. I'm sorry, I'm going off again. I'm sorry. Excuse me.
I want to add something very quickly.
I'm sorry, Sam, go ahead.
Oh, sorry. One of the things I had on my list here, I forgot to say, is we as community, as people of color, need to stop letting gentrifiers in and then following them. They move into our communities. I'll tell you this, in Harlem, my first 3 meetings with the Harlem Coalition was with an Asian woman and a white male. Those were the leaders who's lived in the community for 4 years and said words like, we don't want drug dealers coming in and we don't want people coming in. So it was okay for you to come in 4 years ago, purchase a brownstone at a low number, and now you don't want people in. And that's I tell you something, for real, we as people of color need to stop following these gentrifiers who are our neighbors and suddenly they're leading things. I have a guy I'm dealing with right now who keeps creating these like movements for Harlem and movements for communities of color who has no understanding what it's like to be a Black and brown person. So it's our responsibility too, I'm sorry, they could be our accomplice, but they cannot ever lead the movements of what we know in our communities, and we continue to participate in that. So we have to hold ourselves accountable around that as well.
Yeah. Sam, you're so right. I agree with you. I live in North Philadelphia on a block that I'm watching it just get gentrified little by little by little. It's like, and before you know it, it's all gone. This happened to Latino community in Philadelphia. It was called Green Street in Spring Garden area. I don't think there's one Boricua left in that block, in that neighborhood, not one. But the rents are so high that no one around here can afford $1,600 for a 1-bedroom apartment. So you think about what's going to happen to us. Homeless shelters. We can't all go moving into self incorporated. It's really bad. It's really bad. And some of the colonizers, that I call them, they move into our neighborhoods, they get our homes. Sometimes we have to ask ourselves why. Why? Why aren't we able to hold on to our homes? Why aren't we able to keep our properties up? We have to ask ourselves all of these things. And a lot of times it's because we don't have the same advantages. We don't have the advantages of white privilege. We don't have the advantages of a lot of things. But we watch our neighborhoods and culture go out the window when these colonizers move in and price us out of our own spaces, out of our own neighborhoods, and our own culture is going to be gone. I have walked by colonizers in my neighborhood that look at me like, what are you doing here? What am I doing here? What are you doing here? And I'm really angry at the systems that let this happen. Anyway, I'm sorry. Go ahead, Michael.
You asked earlier, where were we and what's happening, right? And I want to just bring to the spaces, probably, I'm glad it's us having this conversation, but I want to bring into this space that, unfortunately, I believe, and I believing this, that not enough has changed from when we we're doing organizing around HIV and what needs to happen today around the current pandemic. We still have the same people in control of all of the narratives, of all of the money, of all of the strategies, of all of the decision making. They mostly live in West Mount Airy.
Yes.
They don't look like us. They don't socialize like us. They don't come to our communities, and they tell us what is best for us. And guess what? They are our friends. They are our friends.
I wouldn't say
But
friends.
there's no room.
I'm going to say acquaintances. They're not my friends.
Well, I use that word in
I know.
quotes.
I know.
But they're the ones making these decisions, just like they made around HIV and AIDS for the most part, until we challenge them. And they're making the same kinds of decisions today that say what's best for us without even talking to us, without even letting us know they're having a conversation. We find out in the news, or we find out from some post someplace that says this is, the next thing that's happening for your communities. Just thinking about Sam and bringing Sam back into the conversation. Overdoses and overdose deaths have dramatically increased over the last year in Black and Latinx communities. There's been a 40% increase in overdose deaths among Black people over 1 year. There's been a 7% increase of overdose deaths in the Latinx community over 1 year, while overdose deaths in white communities have gone down. Why is that? Does it have anything to do with those who are making decisions about our communities who don't look like us?
Exactly.
Who aren't even inviting us to the meetings to have the conversation. And when we show up at the meetings, they have the audacity, and I do mean audacity, to tell us what's best for us.
Or even worse, when they thank me for my advocacy.
Sam, I see your hand, Sam.
Yeah. Wow. Powerful question, Michael. Yeah, we know that there's not a war on drugs. There are war on drug users and specific drug users of Black and brown users. I recently, and I've been doing this every time I get a mic in my face, I'm challenging Rahul Gupta, who put out a pretty good statement from the White House around harm reduction. He used the term harm reduction and he used syringe exchange. But there was a big issue I had with his piece. And if you don't have it, maybe we could share it on here. One of my folks could share it on here, read it. There were a couple of things that I really pointed out. I'm challenging him on, which is he said we met with the experts. And he then proceeded to say, SAMHSA, HRSA, CDC. I'm like, the experts are right here sitting in this call. These are the experts. We are the experts. So I said to him again, and I said, listen, you're talking about talking to the experts. I almost wish it wasn't me because it sounds like I'm boasting, but I'm saying we started the first two safe consumption sites in the country. Why aren't you talking to us? We are the experts. We're on the ground doing it every day. So stop telling me you're talking to experts. You're talking to each other. And Michael, this is the answer. Then they come up with the policy without us being at the table. And it's just like, what are you guys thinking? So I'm holding him to that. And part of sharing it here is so that we all can stay on that theme. Get us to the table. Stop having conversations about us without us. Like, stop it now. And we need to demand that. So I'm going at him as hard as possible. I'm not going to stop. It was a blessing that he joined a show I was on 1A on NPR. He came on after, and then they let me stay to make comments to him, although I was begging them to let me talk to him directly. But I believe there's hope there. I will say that. I believe there's hope there. I believe he gets it for the most part, but now the challenge is on him to respond to my request.
So I have a few thoughts. I'm listening to everybody about, especially what Mike had brought up about the overdose rates and how they have gone up so high and how it's tied into gentrification. And how I would like to say that often as people, we elect officials that look like us just because they look like us and because they're good with words, but their actions aren't what benefit us. Specifically, my observation throughout the years in Kensington, North Philly, I noticed that after the Gurney Street project, when the railroad tracks were pretty much cleansed, all the active drug users that were living on, they were mostly Boricuas and Black folks, and they were pushed out of a place where they were able to shoot up safely. They were there with each other and whatnot, and they were pushed out of tracks into a neighborhood that's being gentrified. While that gentrification is happening, obviously people don't have places where they feel comfortable consuming. And for me, that's part of the reasons why in Philadelphia, at least, why there's so many high overdoses, specifically with Black and Latinos, based from the data. And it's like Samuel said, we have to hold ourselves accountable. And part of that accountability is ensuring that these politicians, just because that politician's Boricua like me, or they speak Spanish like me, doesn't necessarily mean they're going to benefit me or my community, because that same politician that looks like me, talks like me and whatnot, is the same person that's pushing people out of their homes in North Philly to sell to investors and real estate agents, to people that don't look like us, and they're destroying our culture, our community. It's happening in North Philly. Fifth Street. Fifth Street is basically corazón of el barrio, the heart of the Puerto Rican community. It's being gentrified. There was a time in which you would hear salsa, merengue, bachata, reggaeton on Fifth Street. You would smell sofrito, you would smell chuletas, pernil, people playing congas on the street, being themselves authentically. And now you have these white colonizers coming and calling the cops on us because, you know what, you're playing your music too loud. Or when you speak, you move your hands and I feel so uncomfortable, so threatened, you're gonna come and slap me. So it's and some of those officials are in the city, currently in office. Yeah, that's some of the what I wanted to take off of my chest.
Well, you know, honestly, what we don't talk about a lot of times too is fentanyl. It is a dangerous, highly addictive drug. When people were shooting heroin, I don't remember. I mean, people did overdose, but not like this. How is this fentanyl getting to our neighborhoods? Why is it getting to our neighborhoods? Why is it getting into every drug? Fentanyl is like one of the ugliest, most dangerous drugs I can possibly think of, and it's killing people, you know? So I wanted, you know, when people talk about opioids and things like that, I think there needs to be a clarification because it's not heroin killing people, it's fentanyl. So,
Jose, if I can add something very quickly.
Sure, Sam.
I'm sorry, hold on 1 second, Sam.
Sure.
Jasmine had a hand up, and then Sam will go directly to you. My apologies. Jasmine, you're on mute.
Yeah, I realized that. Actually, Vivi said a lot of what I wanted to say, especially about Kensington and the gentrification that's going on there, and how the current city councilor for that area is supposed to be representative of that area, and it's not. And I went through the chat, I went through the participants and noticed that I didn't see their name there anymore. Because this is a perfect opportunity. You want to say something, explain to us what your thought process is, because you're pushing your community into the street and out past the streets. But yet we're not supposed to have a problem with you. We're supposed to want to vote for you, and we're supposed to want you in office. That's what community control looks like, right? Like you're being accountable to the people that you're supposed to serve. I worked in Kensington. I don't live far from Kensington. I've got kids that live in Kensington, right? And they shouldn't have to go through that. And pushing, like, I want explanations on why we don't have a overdose prevention site in that area. You know, Sam pushed during his opening remarks how they their needle count in the park where the site opened, close to where the site opened, went from 13,000 to 1,000. And that's been one of the issues that you hear from people, from city council people, especially about neighbors' arguments about having safe injection, about having an overdose prevention site around their area. They don't want all the needles. They don't want all the drug users. But this is proof that can change. And having those sorts of things proves what we've been saying for the last, 5-6 years now, that this is going to be the outcome. Go ahead, Sam.
I have a question for Sam.
Sam had his hand raised, Jose. I'm sorry, he had a point he wanted to make.
So just very quickly. So yeah, one thing based on what was just mentioned, all paraphernalia that comes into our sites never leave. We collect it all. So that's a big deal as well. I just wanted to add that. Trying to remember what I was going to say before. I don't remember. So Jose, you had a question.
Yeah, can you move to Philly? I'm joking.
I'll take that. I'll take that as a compliment. Yeah, I mean, I'm close enough, and I like to ride that way on my motorcycle. So let's make it happen. Any excuse to ride south is always, even though Philly's around the corner, is always a blessing. Yeah. Yeah. I mean, I don't understand, and I'm not going to accept that we're not opening more. Unfortunately, I think you had somebody on here who left who has the power, or at least is in a position of power to do something, and isn't. And I think Viviana made a great point. We're putting people in there, and we believe they're going to do something, and then they don't. And there's all this perception about what's going to happen to the community, and bringing in more drug dealers, and bringing in, we have one person who's a member of Congress who's trying to stop us. And it's very simple as to why. Suddenly she cares about Harlem and Washington Heights. Come on, you live in Staten Island, you don't care about Harlem and Washington Heights. She keeps saying she feels that this is going to bring more drugs and more drug dealers. I'm gonna tell you what she feels. What she feels is fear. The fear that this is going to work, it's going to be successful, and they're going to have to open one in her community. That's her fear. Let's also remember, and you asked this earlier, Jose, the reason why they treat our people the way they do is because they see us as disposable people. They just do, right? They see us as people who don't matter, who don't count. And so the more we work closely together, the more movement we have. Listen, they're afraid. The country's afraid that when they run the numbers, there are going to be more. I don't know. I don't like using those words, but I'll use it for this. More Hispanics than any other culture. So it's important for we as brown people to identify as who the hell we are. Do your DNA as who we are. This skin isn't from the sun. I am African, and I am from Borinquen. So that's who I am. So the more we allow, we as Boricuas or other folks allow us to be Hispanic and pulled away, or Latino and pulled away, we need to identify our ancestry. And what we know is if you're from the island of Borinquen, they brought African slaves, and guess what? They made us better people, right? They gave us more, and we have to embrace that, or else we'll keep participating in this mess that we're in.
I want to acknowledge we have some hands. I see Ashley's hand, and then I see Viviana's hand. And Sam, I think you already went, so I'll say Ashley and Viviana in that order.
Thank you so much. Can everyone hear me all right?
Yes.
Okay, good. Yeah, so I wanted to speak on how gentrification is directly impacting the health and wellness of individuals in our community and our community as a whole. And I'm going to do so by telling you a very quick story. So we at GALAEI, we run vaccination clinics for COVID-19. These vaccination clinics are focused on Black and Brown community members, on lowering medical mistrust and hesitancy, and making sure that we are really protecting one another, all the way from age 5 up. We do these efforts. They are not grant funded. We take them out of our general funds because it is the most pressing need right now in this moment, and we must take care of one another, right? So at our first vaccination clinic that we held at GALAEI at 118 Fontaine Street, right behind Kensington Hospital, we have two community members who live on our block. It's an auntie, she's an elder. She is Puerto Rican. She brings us food. She waters our flowers when we are not there. She is just an incredible human being. And she is part of our GALAEI family. Her husband, who is in his 70s, works at the corner store that was historically owned by Latinx folks. That corner store was bought out by a white developer. That corner store, now owned and operated by a white family, would not allow this elder in our community to leave for half an hour to get vaccinated. Would not allow this person the life-saving free vaccination that was around the corner. So we took a nurse and an observer, and we went to the corner store. We gave him his shot inside the corner store and observed him while he worked. We continue to find ways and fight against the systems that are being built, the walls that are being built up around us to actually kill us. We are busting through these walls and finding different ways to get over and under and through so that we can protect our own people. And the entire time we're standing inside this corner store up against, cereal boxes, trying to make sure that this man gets his vaccination. All of us are talking about how if this area had not been gentrified, none of this would be happening. He could be sitting in a seat in our lobby, drinking, a soda or a glass of water and eating the meals that we were provided, looking through our swag bags and our resource bags instead of having to work, and being separated from his wife when he was scared to get this first shot. So I wanted to think about how it's not only that they're taking our homes, they're taking our businesses, they're taking our resources, and they're taking our ability to have life-saving treatments that we need for our communities and for ourselves as individuals. So it's important that we fight back in all of these ways against gentrification. It's impacting all of us. Thank you for that moment.
Hey, Ashley, I remember reading that story not so long ago. I think I don't know where you shared it, but I read about it and I had no idea that you were not being funded to do that work. And listen, this is what I want to say. I have no problem saying to our health commissioner, Cheryl, that's not acceptable. The same way tons of us wrote letters when they gave money to the 22-year-old graduate students from Drexel to run COVID testing sites all around the city with no medical background, no connection to our communities at all. And we had to fight them to give money to the Black Doctors Coalition. We need to do that for the work that you're doing. We should not accept that, Ashley. Let's get that letter together and let's get everybody on here and everybody I know and everybody who's been fighting for all of this stuff all this time, including the Black doctors, to sign that letter and say, this is the work that we've taken on to save our own communities. At a minimum, you need to support it with dollars so that we can do it in the right way. Let's get that done, Ashley. Let's get that done. I promise you, I will get people to sign on to that letter and I'll take the message with you and with whoever else wants to go so that they hear it loud and clear.
Thank you.
I'm sorry.
And folks, if you know anyone that does need to be vaccinated, we are having another vaccine clinic at 118 Fontaine Street, prioritizing QT BIPOC children ages 5 to 11, that anyone can get that vaccine shot on February 12th from 12 p.m. to 5 p.m., 118 Fontaine Street. We'll make sure we take care of you.
Wow,
so
Ashley,
folks, we are running not really behind. We started late, but we are running behind. I want to get to Viv's. Viv has had her hand up for quite some time. So I want to get to Viv and then Jose, I think we need to do a check in on how we can pare down some of the presentation to get to some of the finer points so that we can get to our breakout rooms, which is really where we're supposed to be at this point. Viv?
So for me, gentrification hits me in many ways. And I see what I see, and I name gentrification for what it is. It is recolonization of our Black and brown bodies and neighborhoods and cultures. I'm originally from the Bronx. I moved down to Philly in 2007, and I left New York because of gentrification. Now I'm seeing that here. But it hits me in a whole different way, and I'm going to share about my experience of how it was when I went back home to Puerto Rico in December. And I want to ask this question to the leaders in our community that are attached to public funds. So in Puerto Rico, many may not know Puerto Rico is a U.S. colony of the United States. It was invaded by the Americans in 1898. And as of recently, there are rich millionaires, white Americans, going into Puerto Rico, buying up massive amount of lands and houses, and they're displacing the Boricuas that live there. As a consequence, many Boricuas are fleeing the country because they cannot afford the rents or the mortgages of their lands. And my question that I have is, because historically in Philadelphia, and the council person of the 7th district, which I'm a resident and I'm a voter from, is aware of this. For many years, drug users, people that have criminal records, and people that are homeless in Puerto Rico have been flown over from Puerto Rico to Philadelphia underneath the guise of we'll employ you, we'll find you housing, we'll provide you with a car, a brand new life, all that stuff. And there's politicians that have their hands washed in this because they were getting paid to do this with politicians in Puerto Rico. Consequently of that, many of these Puerto Ricans that were lied to come over here to Philadelphia ended up in the streets because these illegal recovery homes will take away their documents and will kick them out of their homes for the moment they ask a question, why are you feeding me peanut butter and jelly sandwiches every single day? With that being said, gentrification for me, it hits me on so many different angles. I went back to Puerto Rico in December, and it was just appalling to see the amount of white people walking unapologetically white with American privilege, without their mask, looking at me in my own fucking home, like if I'm a foreigner, with that look of what are you doing here? And then have the audacity to ask me for instructions in English. So there's a lot of work that needs to be done. There's a lot of work that needs to be done. Part of this displacement due to American policies, politics, and colonization of Puerto Rico, there's over 5 million of us here in the diaspora in the United States, and there's 3 million of us back home in Puerto Rico. Most of us are here. And the effects of that is the loss of culture, the loss of language, the loss of customs, the loss of community, because of other elements here, such as gentrifications. So the question that I have that comes to my mind is, and it's not an attack to anybody specifically or any of the leaders that are present in the room. What are your thoughts? What are your actions when someone tells you I've been displaced? Or what is your stance on a higher level of platform, or whatever you want to call it?
I see one hand raised. I'm not sure, Sam, if that is in relationship to Vivi's question, or is that catching us up on your point that you wanted to catch us up on from before?
That was from before, so I can wait.
Mike, I think we may want to give away a book soon.
Okay. You want to give away a book? I got a time check from James. Oh, this is going to be a trick question. The first person to put in the chat, what are savior narratives? What are savior narratives? Give an example of a savior narrative. The first person to put that in the chat, Jose and Black and Latinx Community Control will also give you a book. And I see Terry Young. Terry, are we able to unmute Terry so Terry can speak to this? James, are we able to unmute Terry so Terry can speak to white teachers in Black schools?
Oh, sure. Yeah, I'm unmuted. So as an educator here in Philadelphia, I see a lot of well-meaning white people come into the profession every year, thinking that they know about the culture, thinking that they know about the issues because they may have read a book or two on oppression, and they come in with all these assumptions, and but they don't. It really doesn't leave a lot of room for nuance and individual circumstances for the kids, and they often end up just doing more harm than good. And the kids really end up being hurt by this, what I like to call the soft bigotry of low expectation, thinking that, you know, just because they come from a certain neighborhood, just because they're Black or brown, just because English may not be their certain language, that they simply can't do things. So a lot of times they may come with the right intention, but we know that intent and impact don't always mesh. So.
Thank you for that, Terry. Folks, our translators need to take a break. I want to ask if we can just get one more comment in, then we'll have we'll take a 5-minute break. And I'll ask Jose if when we come back, we can go straight into the breakout sessions, just so that we can try to get this back on track. But I really want to, just for a few seconds, Mo, if we can get you to talk about the comment that you put in. And right after that, we'll take a 5-minute break. And when we come back, we'll go to the breakout rooms that are listed on the agenda. So Mo, you said harm reduction groups, especially in Kensington, push the I know better than community. Can you speak to that, Mo? What does that actually look like?
How you doing, Michael? Thank you very much for this opportunity. For those of you that don't know me, my name is Moses Santana. I am an organizer for the Philadelphia Overdose Prevention Network. That does a lot of work in Kensington with Prevention Point, with Soul Collective, a bunch of other groups in Kensington, or around Philadelphia. What I've noticed as a harm reductionist, particularly in Kensington, I'm not going to name any groups, but there are groups who are mainly white groups, and their main focus is usually telling folks how they should live, which is very off-putting to people in the community, to use some people that are using. But it's an idea that because I'm white, I know better than you do. And the whole idea that white is right, no matter what actions are taken by white folk. And sometimes there are good intentions, but those intentions get in the way of people progressing and the situations in the neighborhood and the community getting better, especially with gentrification looming in the background, with folks who are, number one, poor, number two, they've been marginalized by the local government, by the state government, and federal government. People who have been marginalized by the white community in the past, because Kensington was a predominantly white community up until the 80s. And when we started moving into Kensington, things got really bad for us. And we kind of got like boxed in, and then folks from out of nowhere, uh, with the last couple of years at the crack epidemic and all the heroin that was running through Kensington, everybody decided that it was a great idea to come down to Kensington and save the community because they cannot do it themselves. And to me, the community can and will save itself, given the resources and the know-how and building community. But right now, there is an issue of many white harm reduction groups like gatekeeping and being in competition with other harm reduction groups in Kensington, which doesn't make it doesn't help anything. So we're just trying to figure that part out right now. And the politicians have a lot to do with that because sometimes they'll give money to groups that are white led, and then black and brown groups they don't even acknowledge. So we're dealing with that as well. I'm not trying to like put this out there, but I am running for city council for District 7. And I am a harm reductionist. I'm from the neighborhood, and we're going to make some change as soon as we get elected into office. Thank you.
Thank you, Mo. Thank you. Thank you so much for that. And I definitely, I think we all probably, understand exactly what you're talking about, who's getting to say what and when in our communities that oftentimes, unfortunately, do not look like us or know like us what's really happening, right? But they get the microphone, they get the dollars, they get the time and space in front of the media and with the media. And yeah, down with that. So listen, folks, I'm sorry, but we really do need to give our translators who have been doing an awesome job a break. So I'm going to ask if we can take a break now. Jose, is that okay? If we could take a break, it is 12:59. We are behind schedule, but if we could take a break and come back at 12:06, that I think would be helpful. I'm sorry, 1:06, Jose. That would be helpful for us. Is that okay?
That's fine, mate. Wonderful.
Okay. Thank you, everyone. We're going to take a break.
Silent partner here.
No. I'm just getting a bunch of messages, and I do realize that we've been going on and on, and our translators have not had a break. So we want to make sure we do that. Yeah. And then we also want to come back and try to get on track with the breakout sessions, if that's okay with you, Jose. So we'll take a break and we'll come back at 1:06, folks. Thank you.
Kendall?
section. I don't know if there was anyone on the Spanish speaking channel, but I feel like we will just use the recording and just share it across social media because it's still valuable information.
Of course, of course. Let's see. You guys want to give a report back from the trans workshop? Kendall, Jasmine?
I don't see Kendall in the list. Trans workshop went pretty well. We discussed trans misogynoir and the intersections of oppression and what that looks like for our community and how we can come together to overcome that, basically. It wasn't a lot of people. Our participants have dropped like dramatically. We only had like maybe 7 or 8 people in our room. Yeah, I don't know who was.
Something seems to be wrong with my visual and audio. It's like, seems to be like in slow motion right now, the audio and the video, so I don't know what's actually happening. Oh, okay. Viv, how was the Latinx workshop?
It went great. I think there is one person that I can identify that was there. They want to speak on that.
I'm sorry, they wanted to speak on what, Vivi?
If they wanted to speak on that, they could, because I see another person that was in the workshop. There was about 10 people in that workshop collectively. It went very well. I connected the dots to what's happening in Puerto Rico, to what's happening here in the States.
Mm-hmm. I'm trying to watch the time because we're running up on almost the end. If folks still want to hang out afterwards, and we can continue these conversations, you're more than welcome. What happened in the organizing workshop about power? What was going on in the group with the white accomplices and allies?
I can talk about that if you'd like. There were just 3 of us. So basically, I think, and I took no notes, so I apologize. So bear with me while I try to remember. But I think Adrian was talking about like being there and as someone who works in overdose prevention, being there and conversing, just having conversations with people, not necessarily being at the helm of things.
Mm-hmm.
Leaving those seats open to Black and Latinx people, but still like doing the work. If I'm getting that right, Katie, feel free to chime in if you'd like. And then I was also just talking about like white people using their power to perpetuate narratives of, dismantling these narratives of white supremacy. And I know that's like a huge thing, and that leads to sort of how do we do that? But using our megaphone, as it were, to say this is what's happening. From my conversations with you, Jose and Viviana, we talked at one point saying a lot of things need to change. Black and Latinx people need to be running the organizations that serve them. Money needs to be allocated to these community organizations like GALAEI and Babashi. So that's basically how do we change those narratives? That's another conversation, but using our sort of proximity to the megaphone to change those narratives.
Oh, that sounded really interesting. I'm glad you guys talked about that and came up with some of those answers. Well, not answers, but what it is that accomplices can do. I'm thinking maybe, was anybody in the group for Black and Latinx side of things?
I took some notes from that group, and let me pull them up. Okay, here we go. So Marilyn from Greater Philadelphia Health Action Group, which has been doing, which is a federally qualified health center, and she's a physician, but she works on the administrative side, and they've been doing work, particularly HIV-related work, for a very long time, but they've been in existence for over 50 years.
Wow.
Talked about having a seat at the table, about youth. One of the ways to have community control is by having a seat at the table, bringing youth and intergenerational communities to the table, having them at the table. Advocacy of our communities needs to be reflected in healthcare and in public health, making our own table. So initially, Marilyn talked about us having a seat at the table, but then went back and talked about us making our own table. Meeting folks where they are in the community. And then Gladys talked about hiring within the community, creating a pipeline to management, which is, just very important. Like, how do we get public health organizations, other folks to actually hire people in our community, as opposed to always going outside of our community to bring folks in? And then how do we create a pipeline for them to move up into management? And then Victor talked about, Victor, all the way from Washington State. Thank you for joining us, Victor. Victor talked about representation and really brought it to the personal level, right? Representation, comprehensive support for newly diagnosed people to get the best possible care, and about meeting folks where they are. Those are all strategies for community control from a Black perspective, Jose.
Wow, that's incredible.
Jose, I think Gladys has a question.
Sure. Go ahead, Gladys.
Hey, Gladys here, they, them, ellas, or she, her, ella. And I wanted to talk a bit more about Viviana's, not necessarily the other one, but it was really dense, a lot of great information and personal stories, which for me was just needing to process that. I used to live in Miami and have a lot of friends there, but also going back to how important it is to uplift businesses, groups, organizations that are BIPOC, and how I think like bringing back a boycott in a way, the way that our accomplices and allies can also help in a huge way is funneling to those businesses, to those communities. And I think that may be a way to also combat gentrification in a way too. I know that it's developers and it's big money and it's difficult, but I think that if we can funnel that energy and send more information on where these businesses are, how we can do that, then maybe that's how we can start to create the table in a way, or at least the piece of the table or the chairs or something. I thought that was really important how we keep coming back to that.
Wow, thank you, Gladys. For those that didn't know, Gladys handled all of the email and the invitations and all of that good stuff, and also did a lot of translation on the forum. So thank you, Gladys. Big love to you. I'm thinking, the folks that are still with us on this call, how do you guys feel about we get in contact with you for a follow-up meeting? And also, if you go to Facebook to Black and Latinx Community Control, we have a Facebook page there. that folks that are interested, we would love you to join our group, be a part of the ongoing discussion, because this is just the beginning of our attempt at community organizing. Black and Latinx folks, we really want to keep this going. We definitely want you guys to become our accomplices. And I think together with conversations and thoughtful conversations, we could actually like come to, I don't know, I think we can start to dismantle things if we talk about it. I was thinking a little bit today about my friend Michael that, has been trying to protect hundreds of people from getting COVID in his shelters. I can't talk about it, but so much. But most of the people that are living in these self-shelters are Black, and probably mostly Black, probably, I don't know how many brown people there are. But the fact is that all of these folks had rapidly gotten COVID. I know ACT UP has been working and trying to pressure the health department into moving a lot faster than what they're doing. We've been, demanding they open up hotels. We warned them that this would happen again. But there aren't people like us making decisions over at the health department. We're not at the table. And those of us sometimes that are at the table are in fact doing what we need to do to actually protect our own people, because if you don't have health, you don't have anything, right? So those are my thoughts about maybe continuing this conversation. Maybe we will follow up in a week or two for maybe an hour to have another conversation with folks that are, that actually want to do this with us. So as I said, my email is jdmarco@blackandlatinxcommunitycontrol.org. And you can also reach us through our Facebook page, Black and Latinx Community Control. And we will be sending out follow-up emails, and we will be getting in touch with folks. So yeah, I think this, outside of some technical issues that we had today, I think this was pretty good. We had a lot of people when we first started out. I think we've got 19 left. Yay, you guys for hanging around through all of the technical difficulties. We really, really appreciate it. And now I'll turn it over to my partner in crime, Michael.
I'm turning it over to our other partner in crime, Viviana.
You passing the bucket my way. It's all right. It's been a long, productive day. Yeah, we need to have meetings, a follow-up, planning, strategies. Something that I didn't mention in the other in the workshop, but it just came to my mind when Jose was mentioning gentrification. And I think, what is their name? The one who was sending out the emails, invitations.
Gladys.
Gladys. So what's happening right now in Puerto Rico in terms of the gentrification, there's multimillionaires over there buying mansions and telling people, you cannot come into this public beach because now we bought this land. So people are fed up and they're protesting. They're making loud noise. They're protesting 8, 9, 12 hours a day, playing very Black music, very bomba, which is Black music of Puerto Rico, to the wee hours of the night, smoking cigars, smoking cigarettes, having a party, but protesting at the same time. And they've been doing that for every day for about a whole week. So this Puerto Rican carriage is upset with that. And her white American husband, he's upset with that as well too. But that's been going on, and it's working because people are waking up. That's the effect of it. People are waking up versus just having these conversations. There's protest with it, and you have old people, young people that have this anger, see the things that are happening, but now they have a platform to release that and protest and make connections. And I think we need to move towards actions. And yes, we need to have conversations, and yes, we need to plan this, but we need to have actions because through actions, we get more people, more support, and people that want to do something but don't know where to connect to, who to connect to.
Well, here's where I'll jump in. It's called Act Up Philadelphia, the AIDS Coalition to Unleash Power. We have demonstrations quite often. We have a lot of fun planning the demonstration. We have a lot of fun organizing the demonstrations. Our tactics run from making phone calls to going to the homes of our target at night. So I'm inviting everyone to attend ACT UP meetings. We meet every Monday night at 6. I can put these things in an email for you, or you can contact me or Viviana or Gladys. We're all ACT UP members. Jasmine is an ACT UP member. Boy, there's a lot of ACT UP members in this group.
Yeah, I am as well.
Cherry's in the group. So it's a lot of us. So this is what we do. We plan actions. We plan direct actions. This is what ACT UP has done for 30 years for people with HIV. We now know that housing is a big driver of HIV. It's prevention, you know. We know that incarceration, all of these issues that are affecting Black and Latinx people are the issues. So please come and join us. We could really, really use your help. And I'm going to put this out now. We at Black and Latinx Community Control, we are all volunteers. We could use financial support to keep this work going. I know it's blatant, and I know I should be ashamed, but I'm not. We're broke, and we do really
no reason to be ashamed.
There's no reason at all.
Well, you know, you, Vivi, I have no shame. So look at our website, not our website, our Facebook page. Our website is being repaired as we speak, but you can reach us through our Facebook page if you want to make donations to help us going. We have a lot of anonymous white allies that do support our work. So I'm asking, you know, folks to please continue to help us. And I'm so glad we had this time together, as they say on TV, but I really am happy. This was really a great afternoon. It's been a Saturday afternoon, especially during COVID. And yeah, I'm looking forward to following up. I'm looking forward to continuing our community organizing. I will put together an email that you guys will send it out to you guys at the email addresses you signed up with. I'm going to get Gladys to help me with that. And I think this is the beginning of a beautiful friendship. What do you guys think? Jasmine?
Yeah.
Yeah, I think you said it all, Jose.
I would like to add, Jose, that if anyone is interested in helping to plan the next symposium, which we hope to be on, certainly around community control, but include a conversation about HIV criminalization. If you're interested in both of those topics, please reach out to Jose and let us know so that we can begin planning for the next symposium, which we hope to have happen before the end of the summer on HIV criminalization and community control.
Can I just ask a question? Mental health is one of the biggest issues right now for our communities, and it has just become worse with the pandemic. And if possible, if you're open to it, can we add that? And if you do add it, let me know. I have a lot of professionals. We are also in the mental wellness in our community, and we provide support. So let me know, and if that is a topic that could be for the next or the next opportunity, and let me know, Mike or Jose or anyone here, and I'll get you. There's Spanish speakers that we have, and we have French, we have English, and we have Cantonese and Mandarin. So let us know.
I'm sorry,
Viviana, perdón.
Muñeca, can you share a link, please, baby? So we can share this wealth of resource to folks in the community, because I know there's a lot of Latinos in the community that would like to access mental health, but there is a language barrier, there's a cultural barrier. Muchas gracias. Thank you. You can continue. I'm sorry.
You ask and you receive. I'm also going to connect it to APM and Congreso, and I use a lot of organizations because we all are don't have enough staffing, so we work together. And this is something I do outside of my work because mental wellness is hurting, and a lot of our people are out to medicating or dealing with stress in unhealthy ways. So I'm just saying that if that is a topic that you all would like in the future, let me know. And definitely reach out to me, Viviana. It's Viviana.
Yes,
And
I really did.
And I'll send you all my contact information. There's a lot of us that we're trying to help with our mental wellness in our communities. Thank you. I really appreciate the opportunity.
Thank you. Thank you for
That's
sharing that, and thank you for being here.
Yeah, I think it should be no question, and certainly, I give deference to Jose, but I think it should be no question around covering the topic of mental wellness, and especially mental wellness during this pandemic. Our communities have been left out to dry when it comes to the mental health support that we actually need and that which is lacking. And I'll be unapologetic about this. The same people who've been screwing us with COVID, the same people that's been screwing us with housing, go look and see on the Community Behavioral Health website, on the CBH website, who is on the board of CBH, who's responsible for these mental health services. Go look and see who they are. Connect that to the health department, connect that to OHS, connect it to all these other city departments, because they're all city department employees who are on the board of CBH. It's problematic. It's problematic. It's problematic. There, I said it.
Well, you spoke the truth, It's the truth. And they're all the same people. So does anybody have anything else they want to add? Or again, my email address is jdmarco@blackandlatinxcommunitycontrol.org. And you can call Mike itself. I'll give you his phone number. I'm joking.
You certainly can. He's easy to reach.
You guys can reach me. I'm about to put my email, which is basically my last name, first name, 85@gmail.com. And I work at Prevention Point Monday to Friday. You can always stop by, bring me some lunch, some chocolate, some chocolate, and we can have a beautiful conversation. You don't have to do that, but you can always stop by and just say hi. That's more than enough.
Yana, Prevention Point in Kensington or the other one? Which location are you in?
The main building, 2913 Kensington Ave.
Okay, I might stop by one of the next week. We want to do a work with women's health.
Okay.
I'll arrange something with you. I'll send something by email. Thank you so much.
You're welcome. Thank you.
And Prevention Point has been one of our sponsors since we've started these symposiums. And in fact, the director, Jose Benitez, is one of our members.
I'm going to use you, Marco. I need a MOU. I'm going to be knocking on your door with Prevention Point.
Absolutely. No problem. No problem at all.
And again,
Thank you.
I don't want to make sure I said this in the beginning, but I need to make sure that we're acknowledging Philly AIDS Thrift, of all organizations that believe in what we're doing, and they finance these symposiums. And also it's weird as it seems, the AIDS Activities Coordinating Office of the Health Department, I think this is not the ACO of 10 years ago, 5 years ago. So I think they're waking up to a lot of things. Either they're not waking up or we're waking them up. It's either one of the two. But at any rate, the change is slow, but it's happening. So how would you guys feel about a follow-up conversation maybe 2 weeks from now when we can
yes,
maybe have a Zoom conversation Maybe in 2 weeks from now, we'll get it. I'll get Gladys to send out an email for us, if Gladys doesn't mind.
It needs to be on a Sunday, really, though. This is my Sabbath day. I don't normally do work on Saturdays.
Oh, that's right. I forgot that religious thing you have. Yeah. But usually we meet on Thursdays anyway, but we'll send out an email to see what date works for everyone. Does anybody have any comments or whatever about how they feel about this? It's after 3, so
I do have some job
opportunities for a few minutes. Go ahead. I'm sorry.
Oh, se disculpa. I'm sorry, I'm talking over you. I apologize for that.
That's okay. That's all right. Go right ahead.
I have a few job openings that I would like to share with everyone here. So if you don't mind, I'm gonna have your emails here. So I'm gonna be sending some job opportunities at Greater Philadelphia Connection. We try to be as inclusive as possible. And right now with the job market, it's kind of not, it's a more difficult market now. But I think that sending job opportunities to leaders in the community increases the possibility of people knowing and hopefully moving forward with interviews. So if you guys don't mind, the people that have shared your email, may I send some job opportunities down your way next week, if that's okay with you guys?
Definitely.
Yeah, I'll drop mine in the chat.
Thank you.
Yeah, does anybody have any other comments?
I definitely think just kind of as an offshoot of this, I would like to, through community control, have a specific initiative of doing PrEP and PEP outreach. And if anybody would like to be a thought partner with me on what that should look like, I would definitely appreciate it.
Wow, that's great, Terry. Thank you.
So yeah, we can, that's, a very, very new idea that I have. So it's not at all fleshed out, but if anybody, like I said, would like to be a thought partner, I'm definitely open to that.
You can tear my brain apart.
See, this is why I love people from the South to join our group.
Why is that?
Y'all get stuff done.
Oh, well, thank you. Thank you. I try. I know I have, a hard time balancing everything with work, but I definitely try to, contribute what I think I can contribute. And I think that would be, as a PrEP user, that would be one of the most valuable things that I could do.
A PrEP user? Are you promiscuous? I'm sorry, that was just a joke. I'm sorry, that's just a bad joke that people say.
No, you're fine. You're fine.
Always say that. People always blame PrEP, they have another word for people that use
Well, promiscuous is a very relative concept. So
I love it. I love it. Terry, I added my information. We have resources that connect with the organization that I work, and we're looking for partners in the community. So I added my email, and if you could just add me to that group, and I'll connect you with the manager and the director of the program at Greater Philadelphia, if you don't mind.
Oh, okay, yep. So I will, I'll copy and paste your email now, and I will send you a follow-up email. And we can go from there.
Thank you so much. I really appreciate it.
Mm.
If this had been in person, this was the time you were going to have cocktails or horse dives.
Yeah, I'm really looking forward to us all getting together in person.
Yeah, it's really disappointing because we lose that conversational thing. We lose that just in person thing and being with each other and that human thing that happens when people are together. So that was, Michael can tell you, that's our first symposium was like that. I had always, and I still miss that, It's nothing like looking at somebody and laughing or smiling or realizing you have something in common, and it's just misses something. But anyway, Michael, Jasmine, anyone else have anything to say? Oh, I see Kate Singley is still here. Hey, Kate.
I have nothing.
You're still here with us. Victor, Sam, Terry. It's great you guys stayed in this long with us.
Jose, I'm just looking at who's still here, and I'm recalling, I believe I first met Kendall at the
first symposium. Yeah.
I believe I met Micah at the first symposium, or was it the second symposium? I think it was the first symposium that I met Micah.
It was the very first one. Micah was really active in the first symposium.
That was when when we first met too, Mike.
Yep, and that's when we first met as well, Jasmine. Yep. Okay. Got some long timers here.
So whenever
you guys yesterday.
Viviana, we have to do a plena. We get back together, all of us plena.
Yes.
Plena activity or something like that.
Yes, definitely.
Definitely. Well, I'm gonna have to jump out. I take care of my mom on the weekends. It was really a blast. Have a great one, and I look forward to connecting early next week. Take care, everyone.
You too. Have a good one. Thank you, Madeline.
Adios. Cuídense. Ciao.
Adios. Bye.
All right, guys. I think I'm gonna go and find some dinner. So it has been great, and I look forward to seeing you guys soon.
Okay.
Thank you all. Love you. Be safe, everyone. Be safe.
Okay. So long, everyone.
Bye.
Thank you. Bye-bye.
Bye, Viv.